the Ateneo School of Medicine and Public Health Student Council, Bicol University College of Medicine Student Council, De La Salle Medical and Health Sciences Institute College of Medicine Student Council, Pamantasan ng Lungsod ng Maynila College of Medicine Student Council, St. Luke's Medical Center College of Medicine Student Council, University of Perpetual Help System Jonelta Foundation School of Medicine Student Council, the University of the Philippines Manila College of Public Health Student Council, University of the Philippines Dentistry Student Council, University of the Philippines Pharmaceutical Association Student Council, Pamantasan ng Lungsod ng Maynila Supreme Student Council, and the Filipino Nurses United for sponsoring this webinar's Zoom account. Again, for questions, the link for the Google Forms for later's open forum will be displayed at the description box at YouTube and is posted at the chat box of our Zoom meeting. Don't forget, we also have a health sector Twitter rally later at 9 p.m. Let's make our voices heard and make hashtag health is political, hashtag Sona di na maulit, and hashtag Sonag Kaisa trend. Our program will start in 3 minutes. Again, for an interactive and orderly experience of our webinar, please follow our meeting rules. You are encouraged to turn on your video and mute your microphones. If you have questions for our speakers, please reserve them until the open forum segment at the end of all our speakers' discussions. The Google Forms link is posted here at the YouTube description box and the Zoom chat room. Again, let's raise productive and insightful discussion, or you can share quotes and learnings from our speakers. Together, let's promote our advocacy through using our official hashtags for today's event. Hashtag Sona di na maulit, hashtag health is a right, hashtag Sonag Kaisa, and hashtag Sona 2020. We also have a health sector Twitter rally later at 9 p.m. Let's make our voices heard and make hashtag health is political, hashtag Sona di na maulit, and hashtag Sonag Kaisa trend. Again, for an interactive and orderly experience of our webinar, please follow our meeting rules. You're encouraged to turn on your video and mute your microphones. If you have questions for our speakers, please reserve them until the open forum segment at the end of all our speakers' discussions. The Google Forms link is posted at the YouTube description box and Zoom chat room. Let's raise productive and insightful discussion, or you can share quotes and learnings from our speakers. Together, let's promote our advocacy through using our official hashtags. Hashtag Sona di na maulit, hashtag health is a right, hashtag Sonag Kaisa, and hashtag Sona 2020. Again, for an interactive and orderly experience of our webinar, please follow our meeting rules. You're encouraged to turn on your video and mute your microphones. If you have any questions for our speakers, please reserve them until the open forum segment at the end of all our speakers' discussions. The Google Forms link is posted at the YouTube description box and Zoom chat room. We will now start the program. But first, let us offer a moment of silence for a blessed program and for our personal intentions. Good afternoon and welcome everyone to Raise IPSA LOQUITUR, the Philippine government response to the COVID-19 pandemic. This webinar is presented and organized by the Philippine Medical Students Association together with its official partners, Ateneo School of Medicine and Public Health Student Council, Bicol University College of Medicine Student Council, the La Salle Medical and Health Sciences Institute College of Medicine Student Council, Pamantasan ng Lungsod ng Maynila College of Medicine Student Council, St. Luke's Medical Center College of Medicine Student Council, University of Perpetual Health System Jonelta Foundation School of Medicine Student Council, University of the Philippines Manila College of Public Health Student Council, University of the Philippines Dentistry Student Council, University of the Philippines Pharmaceutical Association Student Council, Pamantasan ng Lungsod ng Maynila Supreme Student Council, and the Filipino Nurses United for sponsoring this webinar's Zoom account. Once again, welcome everyone, and I am your host, Bobby Camille Atendido from the National Committee of the Philippine Medical Students Association. For those with us here in Zoom and also for those watching us in our YouTube live stream, thank you all for joining us today as we hear the relevant insights of experts on discussions tackling the administration's pandemic response, including economic programs and the anti-terrorism law. So this course on Philippine governance and society is especially relevant today as we wait for our president's fifth State of the Nation address, or SONA, this coming July 27. And so today, three experts will discuss to us criminal ineptness and negligence to the COVID-19 response, economic stimulus program, and the anti-terrorism law. To formally start our webinar, let us welcome Keith Serrano from the Ateneo de Manila University School of Medicine and Public Health.
Good afternoon, everyone. I am Keith Serrano from ESMPH, and I welcome you all to PMSA's webinar entitled Res Ipsa Loquitur, the Philippine Government's Response to the COVID-19 Pandemic. Throughout the course of this pandemic that we are experiencing, from the shutdown of a major network here in the country to the passage of an unconstitutional bill into law, various sectors of society have raised a very important question. Is health political? In this webinar, where we parallel the physician as the government giving interventions to its patient, the Filipino people, we pose the following questions to our audience. Number 1. Given the government's response to the pandemic, can we consider this health crisis a political issue? Number 2, can we consider our government's economic stimulus program to the pandemic a health issue? Third, is the anti-terror law a health issue to the medical community and the Filipino people at large? Through our esteemed discussants from various sectors of society, we hope you find answers to these questions and ultimately answer the question, is health political? Thank you very much and stay safe, everyone.
So thank you for your message. Thank you for your message, Keith. So again, let's raise productive and insightful discussion and promote our advocacy through using our official hashtags. Hashtag Sona Di na Maulit, hashtag Health is a Right, hashtag Sona Kaisa, and hashtag Sona 2020. So today we have very exciting, intriguing, or dare I say, notorious topics to discuss with our well-known speakers who are experts in their own fields. To start, we have our discussion on the criminal ineptness and negligence to the COVID-19 response. Our first speaker is an associate professor in the Department of Family and Community Medicine in the University of the Philippines, Manila, the chairperson of the Health Alliance for Democracy, an organization of health professionals and health workers, the president of the Board of Trustees of the Health Action Information Network, and the president of the Health Action for Human Rights. Since the 1980s, our speaker has been a resource person in both national and international stages on various health issues, including health and human rights, social determinants of health, health systems, the evolution of health systems, and many others. An advocate for health and health related issues, and here to discuss to us the criminal ineptness and negligence to the COVID 19 response, let us welcome Dr. Delen de la Paz.
Hello, good afternoon everyone. Okay, maraming salamat sa PMSA, sa Philippine Medical Students Association sa pagbibigay ng pagkakataon na makasama kayo ngayon at magtalakayan tayo tungkol dito sa response nga ng government, kung how inept is it and ano yung negligence na nangyari. So yung una-una gusto ko lang sabihin na yung paggamit ng term expert ay hindi naman yan na limitado sa mga taong kagaya ng namin na may supposedly katungkulan, gano'n, kasi anybody can be an expert. And what I'm actually going to share with you is has been the clamor of people. Galing ito sa mga mamamayan na matagal nang nagsasalita tungkol dito sa nangyayari sa atin at hindi napapakinggan. Kaya pinagsama-sama lang namin itong hinaing ng mamamayan na matagal nang sinasabi at sama-sama nating ibato ulit sa pamahalaan at again, remind them of their responsibility. Okay, so can we have the first slide, please? So I just would like to say that this slideshow presentation is a collective effort of the Health Alliance for Democracy, as well as various groups that have been speaking out already on the issue of the COVID-19 response, and also such as the Coalition for the People's Right to Health, COMPAS, the Community Medicine Practitioners and Advocates Association. Kasama na rin ang mga datos na nakuha namin sa ACT or yung Alliance of Concerned Teachers at ang IBON Data Bank. So yung iba dito nakuha din namin sa newspapers, sa mga radio interviews at TV interviews ng ating mga officials. So let's analyze how the response has been in terms of health and do we really see it as a criminal ineptness and negligence. Next slide, please. So pag-analyze natin ang issue, kailangan tignan natin ano yung konteksto na pinagmumulan niya. So matagal nang ang Pilipinas ay sumusunod sa mga neoliberal policies na idinidikta ng international agencies such as the World Bank, the IMF, the World Trade Organizations, and the group of 7 countries led by the US, the UK, on how we will manage our economy. So we have been into free enterprise, into allowing a lot of foreign investment, giving priority to foreign investors rather than our own development. So these neoliberalism policies have actually contributed to a worsening of the social determinants of health, such as worsening poverty, hunger and inequality, continuing lack of access to basic services and poor living conditions, environmental degradation, the worsening conditions of work, precarious employment, work intensification, occupational hazards, and increased consumption of disease-causing but profitable products such as tobacco, junk food, alcohol, fast food, etc. So ito ay talagang nangyayari na for the past so many years. At ito ang sitwasyon na dinatnan natin nung dumating ang COVID-19 pandemic. At itong neoliberal, next please, itong mga neoliberal policies na ito ay nagkaroon ng, ito yung naging dahilan kung paano na-reframe ang public health. From collective health of the population that was being addressed pumasok ang personal health of citizens kasi mas mas pinupush nila yung issue ng financing sa health by way of insurance. Andyan yung social health insurance na kailangan magbabayad ka ng premium individually. Nandyan din yung personal health insurance na bibilihin mo sa mga private insurance companies. At ang naging focus has been curative and biomedical approach to illnesses and disease rather than preventive and holistic. At yung verticalization of health, which is a focus on specific diseases, fragmentation rather than horizontal and comprehensive. Next, please. The neoliberal framework also, next please, has led really to the weakening of the public health systems because of fiscal authority kung saan ang dinidikta ay budget cuts, kaya nagkaroon ng cutbacks in public health spending. Ang naging direksyon ay privatisasyon and commercialization, strengthening of intellectual property rights over medicines and medical technologies, deregulation, tinatanggal yung mga regulations that may reduce profits, at yung devolution, kung saan fragmented ang ating health system. At ang pagpasok nga ng nabanggit ko na kanina, yung mga health maintenance organizations. So itong public health systems, next please, ay mas napahina nung ating devolution. Yung policies na dating nag-emanate from the Department of Health all the way down to the local units, ang responsibility ng DOH ay naroon na lamang hanggang regional offices at ang provinces ay under the direct authority of the governors, and the cities and the municipals are under their respective mayors. So walang diretsong flow from the national to the local. Except for some national programs na matagal na rin naman nandoon. Pero a lot of it really has been on the basis of the local government would say. Next. And in the next place, and in summary, this is what the neoliberal have been doing. Yung budget cuts, devolution, privatization, universal healthcare that is being promoted actually what is being promoted is universal health coverage under the guise of universal health. Next, please. So when we talk of a weak health system, ito yung sitwasyon na natin nung pumasok ang COVID. At ang WHO nga, nagsabi si Dr. Tedros ng WHO, sinabi niya that we don't know what sort of damage this 2019 nCoV could do if it were to spread in a country with a weaker health system. Kaya ito yung concern ng global health. Pero ang nung sagot ni Secretary Duque, next please. Ayan, so sabi ni Secretary Duque, yung mga tinutukoy nila na weak health system, na mahirap, mga developing third world countries yun, at hindi kasali tayo kasi tayo ay middle income country na. So mula sa poll, walang pag-accept na tayo ay isang poor country. We are a developing country kasi dineclare ng economies natin na tayo ay middle income country on the basis of the GDP, which we know for a fact that does not really trickle down to the poor. It's just up there that is being enjoyed only by a very small percentage of our population. So considering that they think of us as a middle income, hindi sila agad-agad tumugon doon sa mga pangangailangan natin bilang isang third world or a developing country. Next, please. Next. So dahil sa mula nung January, kung kailan nagkaroon tayo ng first confirmed case, napakabagal ng response ng ating government sa pagbibigay tugon dito sa COVID pandemic. And the testing were very slow. The procurement of PPEs for our health workers were very slow. The issue of how do we manage our communities was very slow. Kaya ngayon, as of July 24, we already have a total of 76,444 COVID positive cases with 2,103 new ones and 108,779 already reported as mortalities. Next, please. So we're actually back to square one pre-ECQ in March, because what is happening now is really a marked increase in the number of cases, which is very alarming. Kaya kailangan talagang tignan natin saan ang pagkukulang kung bakit hindi tayo nakaagapay dito sa pandemic na to ng mas mabilisan. Next please. At hindi natin na-sustain. Next please. So ano yung health response? So ang sinasabi ni Secretary Duque, nagte-test naman kami, tuloy-tuloy naman ang testing, and in fact we are targeting to test about 10 million people by 2021. Pero nakikita natin sa bilang ng tinetest nila ay napakabagal at sa kulang na rin ng number of accredited testing facilities at yung testing ay hindi libre. Kaya maraming mga tao ang hindi nagpapatest dahil may bayad. And recently, nag-open ng mga facilities ang ating mga local government units to give venue to free testing. Pero ang ginagamit nila ay yung rapid test na hindi naman ganun ka-reliable. Tapos yung results na nakukuha dun sa RT-PCR ay napakabagal. It takes about 1 to 2 weeks for the government facility to release the results. So it's like nag-quarantine ka na rin at hindi mo nalaman ano yung resulta ng test mo. Next, please. So as mentioned earlier also that medical groups caution versus rapid test because it will just give false negative tests because the antibodies that these rapid tests are checking on are not developed until after about 5 to 7 days of the illness. And many of the people are being tested, those asymptomatic are tested before the 5 days that these antibodies are manifested. Kaya hindi pa rin nakikita, kaya nag-negative sila. Pero actually, the virus is there, it's just that the test that has been given is false negative. And because of this false sense of insecurity, they continue going out and become the asymptomatic carriers. Next, please. Next. So ngayong pinapalaganap ang testing, kailangan din, aside from the testing, kailangan may contact tracing. At yung contact tracing ay kailangan gawing systematically and scientifically and with health workers that would really be doing the tracing. Kaso, ginamit nila ang police at ginagamit nila ito rin as cover for their test tracing for those who are against the government. So this is actually what they call a critic tracing. And under the terror law now, if you can be picked up even for any offense, if they will charge you with terrorism, and it can be anything because that issue of terrorism is still very vague. So pero ang sang nakakalungkot dito sa contact tracing ay ginamit ang militarist approach. And now they're also including the chismosa approach, which is again very unscientific and very unsystematic. Next, please. Next, please. So ito nga yung sinabi ko kanina na PNP chief on house-to-house, the PNP chief said that yung house-to-house COVID-19 visits is just like you are looking for a criminal and you're not supposed to be afraid if you're not a criminal. So this is really criminalizing the COVID infection, and instead of looking at it in a humane and health manner. Next, please. Next. So, sinabi rin nila na nagkaroon na sila ng maraming quarantine facilities at the community level, but many of these are not well equipped also with proper measures such as physical distancing, and also, of course, they should have their own sanitary facilities such as toilets, but we see that their quarantine facilities are cramped with people, and this will actually this will actually promote more infection than really isolating them, than if they are isolated in individual areas. But of course, we know this is not available because communities are really have their houses next to each other, at yung mga tao mismo talagang hindi naman madaling ipaghiwa-hiwalayin sila. Kaya ang dapat tignan dito ay paano natin sila mas matutulungan at maintindihan ano ang dapat na health measures na ginagawa. Hindi yung basta na lang kakalad ka rin sila sa mga quarantine facilities. Next please. Yung treatment na dapat ay hinaharap din ng ating pamahalaan ay napakakulang. Kaya alam natin na merong 73 hospitals designated by the DOH for COVID-19 cases nationwide. Pero marami din sa mga hospital na to ay kulang na ang kanilang facilities. Kulang ICU beds, isolation beds, ward beds, ventilators, at ang personnel ay talagang kulang na kulang. So ang private hospitals na unang nag-respond dito kung saan dahil marami sa mga pasyenteng nagkaroon ng COVID ay pumunta sa private hospitals. Umaangal na rin sila dahil kulang na kulang din ang facilities nila. And the government facilities actually can be beefed up by the budgets that they have obtained. Like they loaned a lot of money for the COVID-19 response, but where did it go? Did it really buy medicines or bumili ba ng mga ventilators or nag-hire ba ng mga karagdagang mga tao para mas magkaroon ng more dedicated personnel to address to the COVID-19 patients. Next, please. So, sinasabi nga na yung health facilities are not able to cope, and also more so, next please, the occupancy rate of the hospitals among the private hospitals, because they only allotted about 20% of their beds for COVID, they said that punong-puno na. And also even our government hospitals are also saying puno na because they have to also consider non-COVID patients. But with the increasing rise of cases, dapat yung government hospitals mag-beef up ng kanilang mga facilities. Next, please. So yung lack of health services, health facilities, and transport support for non-COVID-19 patients continue. And this is also what our health personnel are complaining about. Next, please. Excuse me. Sorry. Yung PPEs na dapat ay napo-provide free to our health personnel ay kulang na kulang. Kaya nag-i-stretch sila ng kanilang duty hours kasi pag nagtanggal ka ng PPE, nag-take ka ng break, you have to use another PPE when you don it again. So they keep extending the hours so that the personnel will only be using the PPE for that particular duty hour. So kawawa yung health personnel natin. Extended time, overtime, and they're really overworked because there's so few attending to the needs of the COVID-19 patients. And then they said that PhilHealth will continue to support the needs of our COVID-19 patients. Pero ang sinasabi naman natin, at lumabas nga recently lang, yung mga officials mismo ng PhilHealth nagre-resign dahil hindi na nila masikmura yung corruption na nakikita nila sa PhilHealth. And to top it all, what is very frustrating and also nakakagalit na sitwasyon is yung currently, the newly signed Universal Healthcare Law provides for PhilHealth contributions na kukunin sa mga working individuals, working Filipinos, including our overseas Filipino workers, and they will base it on the amount of salary that you are obtaining. So palaki ng palaki yung PhilHealth premium at napakaliit naman ang natatanggap nating suporta at ang kalakhan ay kinukurakot ng opisyales ng PhilHealth. Next please. So ito yung nabanggit ko kanina, yung tungkol sa mga quarantine facilities na supposedly nakahiwa-hiwalay sila, ika-quarantine sila para wala sila doon sa mga communities nila. Pero dikit-dikit din naman dyan at wala rin, lalo na walang mga sanitation facilities. And masks are not readily made available. And the more important thing also is psychosocial care is not given priority. So marami tayong mga kababayan ang patuloy ang anxiety, ang fear, at hindi natutugunan ang kanilang mental health. Next, please. So I mentioned also the health workers at risk. So as of July 18, we have 3,643 plus healthcare workers infected with COVID. And many of these are nurses, doctors, nursing assistants, medical technologists, radiologic technicians, midwives, respiratory therapists, pharmacists, etc., who have been exposed to the patients, and they themselves have also been affected. So we have to address this because we cannot lose our health workers. Maraming mga wards ang nagsasara dahil ang kanilang health workers ay apektado at kailangan mag-quarantine din at wala nang pampalit dito sa mga health workers na to. Ang government supposedly nag-open for hiring, but the salaries that they are giving are also not commensurate to the hazards that our health workers are being exposed to, and hazard pay is not also being given as mandated by the Magna Carta for public health workers. Next, please. Next. So ito yung mga problems confronting medical and other healthcare workers, yung lack of protection, overwork, heavy work, underpaid, understaffing, lack of stress debriefing, insufficient accommodation and transportation, and stigma and discrimination. Next, please. Next. At ang nakakalungkot, pag naglalabas ng mga information brief, ang ating gobyerno ay hindi nabibigay yung mga tamang informasyon, misleading, natuwa dahil nalampasan ang prediction ng UP, yun ang dahilan kung paano masasabing we are winning against the pandemic, not really looking at the exact conditions. And siguro yung sinasabi nilang nag-flatten na yung curve, tinignan nila yung graph ng pabaliktad. Kaya akala nila bumababa na. Next, please. So yung inadequate, late and inadequate or no economic support of vulnerable sectors and poor communities, this is underlying factor also kung why communities continue to have increasing number of illnesses is because there's no adequate economic support. Next, please. So yung lockdown na ginawa na very harsh, at hindi ginawang mas systematic kung saan in-assess kung sino ba talaga yung mas nangangailangan ng lockdown, kundi talagang lahat hindi na binigyan ng pagkakataon na magkaroon ng patuloy na economic development, hindi na ayos ng ang kanitong sitwasyon, at yung social amelioration program na nagbibigay ng 5,000 to 8,000 pesos per household ay talagang nakitang napakabagal at napaka-inefficient. So people really had to go out of their houses to be able to look for work and to be able to find means to be able to buy food and feed their families. Next, please. So much so that even our very old and ailing drivers and other laborers had to go out and really do something to be able to feed their families. So millions of poor families went hungry, millions of formal workers lost their jobs, while odd jobbers were not able to work. Millions of farmers were not able to plant, or their harvests were wasted. Next, please. So nagkaroon siya ng more economic suffering for the people, at yung sinasabi nga kailangan kasi balansehin. Tapos ngayong bumabalik na tayo sa economic programs, ang nakakagulat ay ang inuna pa yung mga malalaking infrastructure, no? Hindi naman talaga nag-benefit sa mga tao, tulad ng mga build projects kung saan ang inaatupag ay mga highways kagaya ng mga skyway, na ang nagbe-benefit lang naman dito ay mga private cars. So what about helping develop the medium scale and small and medium micro scale industries para sila yung tulungan makabangon agad at makapag-provide ng employment at nang sa ganon, umangat ulit yung economic situation ng ating mga mahihirap na mamamayan. So makita natin na yung economic suffering of the people have not really been addressed correctly and comprehensively. At ito yung nagiging dahilan din kung bakit nagkakasakit ang mga tao at patuloy na na-expose sa mga sakit na nagdudulot din ng exposure and vulnerability to COVID-19. Next, please. At ang mas nakakabahala pa yung militarist response. This is basically a health problem, but the response has really been a militarist one. And next, please. Which we do not agree with. Next, please. So, as I mentioned, the lockdown was also enhanced with militarized activities. So, yung violations, lahat kulong. So, kulong ang ginagawa imbes na tulong. Next, please. Kaya lumaganap ang human rights violations din sa panahon ng lockdown dahil tyranny at ang pinauiral, and we have many experiences on this. The 21 community members in Quezon City who were just asking for basic relief and they were arrested. The barangay tanods who beat up a fish vendor because he was going out to have his fish, to buy the fish that he can sell. And members of people's organizations also doing relief goods have been arrested. And the sad thing is that they're not just arrested, they're even killed. So justice, we are still asking for justice for Jory Portia, a Bayan Muna Iloilo coordinator who was shot while he was helping in a feeding program for affected families during the ECQ. Next, please. And the most recent one, the crackdown on press freedom, the not giving a continuing franchise to ABS-CBN that resulted to its shutdown, and also the loss of employment to so many people, and the loss of information to many of our countrymen, especially in the far-flung communities, whose only means of source of information will be their ABS-CBN radios and TVs. So they have lost this. So this is not just a crackdown on press freedom, it's a crackdown also on the right to information by our people and the right to work of many of the employees that will be laid off because of the closure of ABS-CBN. Next, please. Next. At bakit ganito yung mga naging response? Kaya ang nakikita nga namin dito ay kulang na kulang yung health programs na dapat ay pinasok dito sa COVID-19 response. Bakit? Kasi yung National Action Plan na pinangungunahan ng mga government heads of departments, yung mga secretaries, karamihan sa kanila ay mga retired generals na ibinalik sa gobyerno in the executive branch. And most of them are really using militarist responses rather than humane, participatory community response. And our Secretary of Health, sad to say, has really been very slow in their response. The DOH has been very slow and very inefficient. And so we also call on the stepping down from position by the Secretary of Health now, Dr. Duque. Kasi naging inutil ang ginagawa nila. Napaka-inept. Kaya pag sinabi natin criminal ineptness, it is criminal because it is leading to unnecessary death to a lot of people. Next, please. Next. At ang inuuna nila ngayon at sinusunod sa ganitong mga ginagawa ay yung pagtatawag ng tsa-tsa. Hindi natin namamalayan na kapaglabas na sila ng mga panukalang batas kung saan magbibigay na ng 100% ownership to foreign investors. Ito ay para i-legitimize yung matagal na nilang ginagawa. Yung pagbabalik ng mining, tinanggal na natin ang mining due to the Mining Act ay talagang pinapa-minimize at talagang well-regulated dapat ang mining. At si Secretary Gina Lopez ay sinuspend ang maraming mining companies. But the latest report we have is they will again revive the mining companies of those that were suspended. So what kind of a response is this? Ang problema natin ay ang sakit, problema natin ay kawalan ng trabaho, ang problema natin ay ang kawalan ng suporta para sa mga mamamayan, at ang inuunang bigyan ng pansin ay ang mga foreign investors. Hindi pa nga natatapos yung mass testing at yung pagbibigay ng ayuda. Ngayon, ang binibigay na solusyon ay ang Chacha. Next, please. Next, please. Kaya yung mga demands na mula pa February 8 na inihain na ng head sa DOH at sa gobyerno na ito ang dapat tugon natin sa pandemya ay hindi talaga nabigyan ng pansin. Noon pang February 8, sinabi na namin we should allot sufficient budget for testing, treatment, and control of COVID-19 for public health services. We should conduct free and systematic mass testing so that we will know what the conditions is, and we should procure sufficient testing kits. We should set up isolation and quarantine facilities in all cities and municipalities. Pero yung quarantine facilities na maayos at makatao, yung mag-set up din ng COVID-19 specific hospitals at the nationwide with adequate health personnel, isolation rooms, and equipment. We should ensure the protection of all health workers, provide them with adequate personal protective equipment, transportation support, free accommodation near their workplace, and food support. Sabi ni Secretary Duque, hindi naman daw tayo nahuli ng pag-procure ng PPE, nauna lang yung ibang bansa. Ano pa kaya ang tawag doon? So we should also immediately pay and raise hazard pay benefits, hire doctors, nurses, and other health personnel, fill up the 13,000 vacant plantilla positions, hire one public health nurse per barangay. We have 42,000 barangays, and there should be 6,000 nurses for COVID-19 hospitals and additional 3,000 doctors to be hired. We should ensure assistance and medical care to non-COVID patients who needs immediate health care and hospitalization. Yes, we should not neglect the non-COVID-19 patients kasi marami pa rin ang may chronic illness tulad ng tuberculosis, tulad ng hypertension, diabetes, cancer patients na hindi nabibigyan ng tugon ang pangangailangan nila dahil nag-focus lang sa COVID-19. These are still our patients, and this is still the character of our health system. We have a lot of chronic diseases and we have a lot of other infectious diseases that are not COVID alone. Provide adequate economic support to vulnerable sectors and poor families. Ito yung sinasabi natin foremost na focus dapat dahil kung wala yung economic development ay hindi rin mag-i-improve ang ating health situation. And we should develop and expand public healthcare system. Itong importante kasi umaasa ang gobyerno sa private health system. Samantalang responsibilidad ng pamahalaan ang pagpapalakas ng public health system. At ang mamamayan ay dapat sa public health system dumudulog dahil dito libre ang services dapat na binibigay ng ating gobyerno. Ngunit dapat ito ay quality and comprehensive health services. Next, please. Next. And so with those demands that we have been airing since February, and with now it's July, malapit ng SONA, malamang kung ano na namang mga promises ang ibibigay, ang sinasabi namin, ang pamahalaan ay dapat tugunan muna ang existing situation, tigilan ng neoliberal policies na nagdudulot ng pagsisira sa public health system at yung ating mga demands for comprehensive, quality, free healthcare ay dapat natugunan. Dahil hindi ito natugunan ng pamahalaan ang ating grade para sa kanya, ang kanyang response ay bagsak. Fail ang government in its response to the COVID-19. It has been criminally inept and negligent. Yun lang po at maraming salamat. At sana ay sumama tayo sa SONA, activities ng SONA Kaisa sa Lunes. At sama-sama pa rin tayong ipakita ang ating pagkilos as a group of organized and organized and responsible citizens, informed citizens of what is happening in this country. So thank you and mabuhay kayo. Binabati ko ang PMSA sa kanyang patuloy na pagbibigay halaga sa mga ganitong usapin at pagpapaabot sa mga estudyante sa buong Pilipinas.
Mabuhay rin po kayo, Dr. Delen. Thank you very much for that comprehensive discussion on our country's situation in this pandemic. Again, it's highlighted to us health's multifactorial nature. Thus, as medical students and concerned citizens, as Filipinos, these issues should inspire us not only to study better to serve as health workers in the future, but to act now as well and advocate for our future patients. And if you want to learn more about the campaign of the health sector in this year's State of the Nation address, access the Philippine Medical Students Association's primer at PMSA's Facebook, fb.com PMSA National, and Twitter at PMSA National. Again, if you have questions for our speakers, please reserve them until the open forum segment at the end of all our speakers' discussions. The Google Forms link is posted at the YouTube description box and at the Zoom chat room. Moving on, learning how the industry and economy in the Philippines works is a good way to put things into perspective for our health situation. Thus, our second discussion is on an economic stimulus program in this pandemic. Our speaker is the Executive Director of IBON Foundation, an independent non-government organization providing research, information, and education services to people's movements in the Philippines and abroad. He is also a board member of the alternative media outfit Alter Media and the Civil Society Network Council for People's Development and Governance, a fellow of the Center for People's Empowerment and Governance and the Center for Anti-Imperialist Studies, and an editor of the online news magazine Bulatlat. He previously worked as staff in the National Economic and Development Authority NEDA as an evaluator of NGOs with Management Systems Advancement Incorporated, as a legislative officer in Congress, and as a rural community organizer. He obtained his master's degree in development studies and bachelor's degree in philosophy and economics with upper second class honors from the London School of Economics and Political Science. Again, to discuss on an economic stimulus program in this pandemic, let us welcome our speaker, Mr. Sonny Africa.
Magandang hapon. Pwede magpa-share ng screen kay host. Sorry. Salamat sa invitation. Sana may makuha naman kayo sa aking maikling input. Okay. Sige. May nakita kayo or imagination ko lang to?
May
Okay
nakikita
naman.
po kami.
Okay, sige. Okay. Wait. Ay, sorry. Nilito ako. Okay. Okay, thank you ulit. Ang isi-share ko actually quick analysis, but hopefully sharp enough na maging useful dun sa nakita namin ng problem dun sa government response in terms of stimulating the economy. Medyo sigurado kami kung hindi man sa SONA kasi nabobore si President Duterte sa economic issues. Pero sure kami, if not during the SONA, siguro in the coming weeks, lalo na as the economic crisis worsens, and especially in August, kapag in-announce ng second quarter economic growth figures, sigurado kami, the government will start bragging about its stimulus package. Pero I think this early on, at least the information we have so far, things can change if they change their mind, although it's unlikely. From our reading right now, actually, ito na yung pinaka-conclusion namin. The government will, in the coming weeks, guaranteed claim that there's a stimulus package, that it's doing so much, that it's doing everything it can, that it's fighting with all guns. Grabe, nandinig na namin lahat ng mga hyperbolic claims ng government. But hopefully, my one message that Ibon would like to share with you, there is no stimulus package from government. Okay, so of course, I think always something important to start out with ano ba yung diagnosis ng problem. Of course, the problem which si Doc Delen shared comprehensively, which I of course won't repeat, but I think let's start from a clear, parang we're on the same page. The Philippines is really facing its worst health crisis and economic decline in its history. So wala kaming data from pre-Commonwealth era, but at least from the modern era, since naging republic tayo, this is really the worst health crisis and economic decline in the country's history. Si Dr. Len talked about naman yung how uncontained the pandemic is and also how inadequate the healthcare is to COVID patients. I think that's important lang to as a take-off point kasi ultimately, walang economic solution kung hindi nakahanap ng health solution. Because the bottom line is, if the pandemic is still spreading, if people are still scared to go out, mapipinayan ng economy. So I think that's very basic. So the government cannot claim to be addressing the economic problems kung hindi niya na-address first and foremost yung health problems, which as Dr. Len very sharply articulated, is not actually being addressed. So yun ang starting point ng problema dun sa government response. But in terms of economic decline, again, also just to make sure that we're on the same page, the economy has been slowing even before the pandemic. At para sa amin, that's so important to highlight kasi the government keeps saying, okay naman tayo before the pandemic, nagkakaproblema lang because of COVID-19. Actually, that's not true. Even before the pandemic, the economy was slowing for 3 straight years and heading for its 4th straight year of another slowdown. So the pandemic, ang ginawa niya, lalong pinalala yung slowdown. Pero 100% sure, even without the pandemic, the economy was still weakening. But important yon kasi if the economy is weakening, ano bang human face ng weakening, actually yung walang kapantay na kawalan ng trabaho. Ngayon, may long pattern ng recording government of not counting everyone who's unemployed, but tumampok to, I think, during the pandemic. The government reported only 7.3 million unemployed in April. Hindi yung totoo kasi hindi nila binilang yung mga hindi naghanap ng trabaho. Ngayon, kung wala ka ng trabaho, naka-lockdown, of course, hindi maghanap ng trabaho kasi bawal ka nga lumabas ng bahay. Ang ginawa namin sa IBON, yung mga hindi naghanap ng trabaho because naka-lockdown, binilik namin sa unemployment data and not the world of over-optimistic statistics, hindi 7.3 million lang unemployed sa Pilipinas, kundi actually 14 million. That's not even counting another 6.4 million na may employment ka, pero ang baba ng kita mo, so you're looking for more work. So, ang totoong itsura ng jobs crisis natin, walang kapantay sa kasaysayan ng Pilipinas, is 14 million unemployed, plus another 6.4 million na, well, ang tawag underemployed, pero ang basic lang dun ay mababang kita mo, so naghahanap ka ng trabaho. So, alam ko ang dami-daming numbers yan, pero kailangan ng ma-stress, even before the pandemic, wala nang kapantayang bilang ng trabaho sa bansa. With the pandemic, lalo pang lumala ito. So talagang record joblessness ang kinakaharap natin, and medyo na-alluded to ni Doc Delen kanina, kung may tinatawag na social determinants of health, jobless people na walang kita and are mahirap aren't actually healthy people. So nag-worsen siya with the pandemic. Ito quick data lang to show na even sa DOLE data, underestimated yan ang displacement data ng DOLE. So in the face of over 8 million losing their jobs because of the lockdown, ang nireport lamang ng DOLE ay 128,000. Basic reason is DOLE only reports yung mga nawawalan ng trabaho sa formal enterprises na nag-uulat sa kanila. Because sobrang backward ng Philippine economy, sobrang daming informal sector workers, sobrang daming unregistered enterprises. In the real world, hindi nag-uulat dun sa DOLE yung mga nabibilang na walang trabaho. Pero even then, libo-libo ang makita niyo dyan, libo-libong empresa ay nagsara o kaya nagbawas ng trabaho. Naka-add lang din dyan ay yung, for now, 82,000 na repatriated OFWs, but yung yung OWA and DFA have also estimated na 300 to 400,000 OFWs natin ay either mawawalan ng trabaho, matatanggal, or mababawasan ang kanilang kita. Meaning, may impact sa remittances. And I'm just adding that here kasi apart from yung human cost na dumami ang bilang, walang kapantay, ng walang trabaho, nag-worsen yan by a lot of closures and bankruptcies, and nag-worsen also by even yung pinaka kumbaga crutch natin for work, yung overseas workers, ay nababawasan din. So that's just to sum up, ang tindi ng problema natin sa ekonomiya na kailangan harapin ng gobyerno. Which brings me finally dun sa usapin ng stimulus. Ano ba yung stimulus? Well, sa tindi ng crisis, the bottom line is yung government lang ang pwede mag-respond. I mean, yung depth ng crisis ngayon, hindi ubra na we leave it to the free market to sort it out, for the economy to correct itself. The problem is so bad, the government has to intervene because the government is the only one with the resources and authority and capacity to intervene to solve that big problem. And sobrang halaga yon kasi yung gravity ng problem, which needs a serious government response, nag-feel yung government doon. Tulad nga na pag ipidoktelin, nag-feel talaga yung government. Kasi sa ganyang klaseng grabing health crisis, economic crisis, yung stimulus ay critical to solve the economic problem. At sa pinakailalim, nakapaliwanag dyan, for something to be called a stimulus, dapat dagdag, dapat bago. You can't say na pareho lang ginagastos mo at may stimulus ka. Parang adrenaline, di ba? Parang walang adrenaline rush kung walang adrenaline. So you can't say may stimulus if you're not actually spending more than before. At on the three main elements ng stimulus package dapat, first, strengthening and expanding the health system, yung nabanggit kanina. Also secondly, yung economic relief to protect households and increase aggregate demand for consumption. And third, to support business and economic recovery. Actually, on all three counts, failed din yung gobyerno in terms of saying na meron siyang stimulus. Ano base natin for saying na super fail siya? Well, yung sabi, super fail talaga siya. Una, grabe siya magtipid talaga. Sabi ng government, we're being fiscally responsible, na ganon. But yung reality, there's a way to estimate the amount of intervention, yung magkano ginagastos mo relative to your economy. So yun ang sasabing percentage of gross domestic product or percentage of GDP. Makita sa kaliwa, yung Philippines for 2020 as of the latest IMF data as of mid-July, katumbas naman ng 4.6% of GDP yung stimulus ng government. Notice, compared to Singapore, Thailand, Vietnam, Indonesia, di habak, pinakamaliit ang layo ng stimulus package ng Pilipinas. Medyo nakaangat lang ng konti over Malaysia. Pero basically, kumukulala tayo among the most comparable countries sa region. Super kumukulala yung Pilipinas in terms of the stimulus package. Pero, sa chart sa right, yung naka-red bar dyan, syempre hindi ko nilagay lahat ng mga countries dyan, no? Pero para makita nyo in relative terms, saan ba yung Philippines in terms of giving stimulus packages as a share of GDP? Papansin nyo, nasa bandang, mukhang middle lang countries, but sobrang nasa low end talaga tayo ng pagbibigay ng stimulus. And I think important to highlight yan kasi whether looking at regional data or international data, the whole world, yung Philippines has among the weakest fiscal policy responses or the weakest stimulus responses. So talaga tinitipid tayo. Sinasabi ng government, kailangan natin gawin yan kasi we should, dapat isaalang-alang natin creditworthiness natin. Well, for the record, yung 3 countries na yan, Thailand, Vietnam, Indonesia, actually even Malaysia, mas mababang credit ratings nila. Hindi sila as fiscally or financially stable as Pilipinas. But despite that, nag-i-effort sila gumastos para sa kapakanan ng kanilang mamamayan. So I think sobrang important to stress yan kasi if yung mga countries na to, by global rankings in terms of financial fiscal stability, mas mabuhay sila, but they're still spending more. What does it say about the Philippine government? Na pinagmamalaki, one of the most fiscally responsible in the world, pero tinitipid naman yung mamamayan. So may warp priorities dyan. Kung very bad yung performance, comparative terms ng Pilipinas with their regional neighbors and with the rest of the world, actually, even comparing ourselves with ourselves, makita dito, yung budget increase for next year and for 2022 ay actually ang liit. So naka-highlight dito yung 1997 financial crisis, yung 2008 global financial crisis, at yung 2020 COVID crisis. Ano mapapansin dito? hindi pwede sabihin ng government na mag-stimulus spending siya kasi yung proposed budget for 2021 is only a 5.7% increase, the smallest budget increase in over 10 years. At yung 2021, mas tinipid pa, the second smallest budget increase in 3.5 decades. So ano point na ma-stress dyan? Walang pwedeng sabihin na gaganap na stimulus kung mas konti yung budget increase mo ngayon compared sa mga nakaraang taon. So ano yan, just to highlight na the government is actually going to be lying to us if it says na, we're spending so much, because they're not actually spending more, they're spending less compared to previous years. Yan nga. So on average, 11.3% ang increase in budget every year. But with this crisis, 5.7% lamang increase in 2021, 1.8% in 2022. So tinitipid tayo in the coming years despite the worst crisis in Philippine history. Ito just to highlight, actually pumapalpak na nga yung government, pumapal yan na, despite big budget increases, double-digit increases in the last years, nag-slow down pa rin yung economy. So medyo kailangan yan ma-highlight kasi kung despite yung sobrang laking ginagastos at sobrang laking increases in the last years, kung despite that, humina pa rin ang economy, ano pa kaya ngayon na binawasan pa yun? So this is to stress na totoo lang magkakaroon ng some kind of growth next year, but only because bumagsak this year. So ano yan, ang tawag dyan, ang term dyan minsan sa finance, dead cat bounce. Kumbaga yung patay na pusa, tapon mo sa off the top of a building, mag-bounce din yan. Hindi dahil buhay siya, kundi dahil nag-bounce lang talaga siya. Pero patay pa rin siya. So just to say na kahit magkakaroon tayo ng mas mabilis na economic growth next year, that's only because ang bagsak natin this year. Tapos, second major point namin, una, sobrang tinipid na tayo ng government, pero even yung ginagastos niya, nakabias naman para sa mayayaman. So, naiiwan yung mamamayan. So, dun sa three elements na nabanggit kanina in terms of a stimulus package dapat, yung health system, economic relief, at yung support sa negosyante, yung nakabilog dito, mapapansin nyo, ito yung pinaka-latest na in-announce sa Department of Finance. Mapapansin nyo, whether under the Economic Recovery Plan, ang tawag nila PH Progreso, or yung sinasabing CREATE Law, nakalimutan ko nila sabihin ng CREATE, parang COVID response, kasi invento na, na term, kasi ito yung dating Train Law Package 2, tapos tinawag na Trabaho Bill, tapos tinawag na SITIRA, ngayon tinawag na CREATE. Sorry ng senior moment ko, nakalimutan ko na. But it's basically an old corporate tax break na ibibigay ngayon. Ang gusto ko lang ma-stress dito, in terms of yung health system, walang inaalat yung government to improve the health system under PH Progreso, that's on the website. Wala rin sa CREATE Law, makita niyo sa naka-file ng mga bills sa Kongreso. At wala din binibigay na economic relief, habang daang-daang bilyon na binibigay sa mga negosyante. So, is that bad? Well, not completely bad kasi ekonomiya naman, may dalawang part siya, supply-demand, consumer-producer. Tama naman na mabigyan ng suporta sa producer, sa negosyante, pero hindi tama na disbalance at walang binibigyan na akibat na attention dun sa producer. So, yan ang base namin for saying, actually, in daang-daang bilyong sinasabing government na stimulus program, apart from actually maliit lang siya, kung susakatin by GDP, hindi ba binibigyan actually mga tao at naiiwan sila. Ito pag-visualize lang namin dyan kasi kung ito ang total employment sa bansa, you have 31 million in the informal sector, 2.8 million in government, then 9 million in formal enterprises. Yung i-announce ng government na daang-daang billion for the Bayan 2 bill, 667 billion pesos in create corporate tax breaks, or 233 billion for additional liquidity. Ang very striking dyan, lahat ng parang wow, ang dami-dami binibigyan ng suporta, at most, ang maaabot niya ay yung 9 million employed in formal enterprises. Walang tulong sa mga households na nag-rely on government incomes. Okay na yung mga yaman. Nag-salary increase na kayo, pero yung rank and file, ng problema yan. Lalong-lalo na walang binibigyan na tulong dun sa informal sector. May token sila, admit, may konting 10 to 15 billion sila supposedly for the informal sector. But in the grand scheme of things, in the middle of the worst unemployment in Philippine history, ano lang yon, decoration lang yun to sino kung ano tinutulungan. But at the end of the day, looking at the big picture, walang ibibigay actually sa substantial sa informal sector, much more even dun sa mga increase na unemployed Filipinos in 2020. And sa amin, yun ang pinaka biggest sin in terms of the design ng program. Sobrang nakabias towards formal enterprises, sobrang kinakalimutan yung mahirap na mga pamilya, samantalang silang pinaka-nangangailangan. The government says no money. Well, frustratingly, hindi yun totoo kasi in terms of yung utang, did you know, nung first 2 months ng taon, January, February, even before COVID, the government borrowed more than it did in the whole of 2016. So actually, ang ginagawa ng government ngayon, ginagawa niya excuse ang COVID to borrow more. But ito yung irony, sabihin niya, lumalaking utang because you have to borrow for COVID response. Pero nakita niyo naman kanina, actually konti lang ang COVID response nila. Sa totoo lang, pinakamalaking part ng government borrowing is not going to COVID response. It's going to yung kanilang favorite build infrastructure program. And actually, irony of ironies, going to repaying debt to those you're borrowing from. So it's so weird. Walang pera daw gobyerno, so babayaran niya yung utang niya. Tapos, ang pag-uutangan pa niya ay binabayaran ng utang. So, kumbaga, yan ang tawag ng debt trap, di ba? Even yung mga so-called development agencies like World Bank and ADB, may big fuss ngayon na, bait-bait nila, pinaputangan tayo. But actually, step back, magtanong ka, teka, so happy tayo na umuutang tayo sa World Bank at ADB. Kung utang tayo sa kanila, madadagdagan tayo ng utang. Actually, for 2020, malaking binabayad na utang sa World Bank at sa ADB. If they really wanted to help, if they really development agencies, para mas sensible, time out, pwede ba huwag mo namin kayo bayaran ng aming utang sa inyo? At sa halip na umutang kami ng bago, we'll restructure na lang our debt payments kasi may mas urgent kami yung pagagastusan ngayon. Pero hindi ganun ginawa ng gobyerno, hindi rin ganun ang binolunteer ng World Bank and ADB. Sa halip na putulin ang debt servicing, including to the development agencies, sinabi nila, keep paying, kasi paputahan naman namin kayo ng bago, which looks like a debt trap. So, sa amin hindi totoo na tama sabihin ng gobyerno na walang pera kasi actually, meron pwede pagkunin ng pera even in terms of realigning lamang yung current spending. Much more, kung gusto nila actually ng dagdag na pera, well, the government can always tax the rich even more. They can tax income even more, they can tax wealth even more if they really wanted money. But unfortunately, ang debt ng gobyerno, in the middle of the worst crisis in Philippine history, added taxes on the poor and middle class, while tax breaks for the rich corporations. So parang, if you sum it all together, it's so worrying kasi ang laki ng pangailangan for stimulus, pero hindi nag-stimulate ng economy and government, hindi pinagagastosan yung mamamayan, including yung emergency relief and yung health needs niya. If anything, dinadagdagan pang boost sa kanila. Basically, binabawasan pa yung kanilang take-home pay or yung kanilang kita from the new taxes. Yan, oil tax, yung shopping, Netflix, matamis na inumin, chichirya, yan, tataksa niya. At the same time, ang pinakamasaya dito, yung mga corporations. The government likes to make a big fuss kung waring create law, corporate tax breaks para sa micro, small, and medium enterprises yan. Sobrang di totoo, kasi 75% ng income tax ay binabayaran ng large corporations. Ibig sabihin, kung magbibigyan ng tax break, 75% ng pakinabang na pupunta sa large corporations, hindi sa micro, small, and medium enterprises. Pinakatanong, in the middle of the worst crisis in Philippine history, kailangan ba ng tulong ng mga large firms? Actually, hindi. They will survive. They will probably even eat up market shares sa micro, small, and medium enterprises. May pogi points pa sila from all the corporate social responsibility and donations. But in the end, pag humupa na yung crisis, which it will, lahat naman ng bagay, humuhupa, all pain, heartbreaks, and everything. Nag-fade naman yon. Pero yung worst thing about this create law and about the government fake stimulus, at the end of it, kapag humupa na yung crisis, masaya yung mga large corporations because they'll be paying less income tax. And if they're paying less income tax, it also means there's less government revenue for, guess what? For healthcare and for economic relief. So parang, yun ang sobrang frustrating. We're stuck in a trap Ito na yung moment ng government to shine, to show how much it really cares about the people and putting its money where its mouth is. But for the three major things ng panukat natin for a genuine stimulus package, walang totoong stimulus. If anything, what we have is sobrang grabing omission, inaction, and negligence. If the economy, we are not businesses. The economy is the people. Pinapabayaan ng gobyerno yung mga tao. Kasi sa totoo lang, pinapabayaan yung ekonomiya. Support niya mga malalaking negosyante, but mga oligarkiya naman yan at mga foreign transnational corporations, not the people. Yun po. Thank you. Oops. May napansin niyo.
So thank you po very much, Sir Sonny Africa, for that discussion on the economics of this pandemic. There's a lot that was tackled to us by Sir, but let's backtrack on what he said. To quote Sir Sonny, he said, "There is no economic solution if there is no health solution," unquote. That is why more than ever, we should focus on a solution medical right now. So how? Again, if you want to learn more about the campaign of the health sector in this year's State of the Nation address, we can access the Philippine Medical Students Association's primer at PMSA's Facebook, fb.com/PMSA National, and Twitter at PMSA National. For now, let's have a short break before our last speaker, and we can take this break to digest the thoughts and discussions that were presented to us. Again, we will have a 5-minute break. It's also time to think if you have questions for our speakers. And if so, please reserve them until the end of until the open forum segment at the end of all our speakers' discussions. The Google Forms link is posted at the YouTube description box and Zoom chat room. Let's also use this break to raise productive and insightful discussion, or you can share quotes and learnings from our speakers. Together, let's promote our advocacy through using our official hashtags. Hashtag Sona Di Na Maulit, hashtag Health is a Right, hashtag Sona Kaisa, and hashtag Sona 2020. Again, the Philippine Medical Students Association would like to thank their official partners for their assistance to the organization and dissemination of this seminar. Our official partners are Ateneo School of Medicine and Public Health Student Council, Bicol University College of Medicine Student Council, De La Salle Medical and Health Sciences Institute College of Medicine Student Council, Pamantasan ng Lungsod ng Maynila College of Medicine Student Council, St. Luke's Medical Center College of Medicine Student Council, University of Perpetual Health System Jonelta Foundation School of Medicine Student Council, University of the Philippines Manila College of Public Health Student Council, University of the Philippines Dentistry Student Council, University of the Philippines Pharmaceutical Association Student Council, Pamantasan ng Lungsod ng Maynila Supreme Student Council, and the Filipino Nurses United for sponsoring this webinar's Zoom account. Okay, so welcome back, everyone. Our break is over, and let's all tune in again to listen to another relevant discussion on our government's response to the COVID-19 pandemic. Let me introduce, last but not the least, our third speaker who will discuss to us about the anti-terrorism law. He is a people's lawyer and a Mindanaoan dedicating his voice to the fight for the ordinary Filipinos. Moreover, he is a member of the House of Representatives representing the Bayan Muna Partylist. Again, to discuss to us about the anti-terrorism law, let us welcome our speaker, Congressman Carlos Isagani Caloy Zarate.
Excuse me po, Sir Zarate, naka-mute po kayo. Or hindi po rinig.
Is it okay now?
Yes po.
Okay. So, maraming salamat. Pasensya doon sa technical problems. No? So, didiretso na ako doon sa aking topic ngayong hapon, itong usapin ng terror law. And I'm glad na nauna si Dr. Dylan at si Sonny na mag-discuss nung dalawang topics dahil ito nga talaga ang problema ng ating bayan ngayon. No? Isang medical and health problem at economic problem. No? Itong dalawang litratong nakikita nyo ngayon, itong nasa kaliwa, ay ito yung mga kababayan nating locally stranded individuals na nasa Rizal Memorial Stadium ngayon. No? Sabi nila sa Lunes, bawal mag-mass gathering dahil bawal yan. Pero tingnan nyo yung ginawa nila. No? Tinipon nila yung mga kababayan natin, walang social distancing at marami dyan ay walang mask na hawak. So they're even putting our people in the more vulnerable situation. Sa kanang bahagi naman, ngayong araw din nangyari yan, yung ating mga health workers sa NKTI. No? Overwhelmed ng NKTI. They are supposed to be a specialty hospital for kidney patients only, but they are also catering to other cases, other patients, especially yung may problema ng COVID. So kung ito pala ang problema ng ating bayan, medical, isang krisis na pinalala pa ng pandemya ng COVID, ano dapat ang tugon? Ewan ko kung ano ang tugon dahil ito ang tugon ng ating pamahalaan. No? Sa halip na medical and health and economic bills or laws or policies ang ipinasa, ang ginawa, certify as urgent ito. Sinertify as urgent sa Kongreso. Kaya naman, bago kami natapos sa aming first regular session noong June 5, pinasa nila ang new terror law sa House. No? In fact, walang debating nangyari sa House dahil ang nangyari, pina-adapt na lang kung ano yung ipinasa ng Senado last February, noong May 29 sa Committees on Defense and Public Safety and Order, ipinasenta na yung Senate version at sinabi ito nang i-adapt natin at wala ng debate. Nagkabutuhan, natalo kami, dalawa lang kami ni Congressman Kit Del Monte ang bumoto ng no. At nung isinalang na ito sa plenaryo at ipinasa noong June 3, there were more than 71 I think, or 76 na pumabor dito. 36 kaming bumoto ng no and there were 29 who abstained. No? So hindi lang ito amendment sa dating batas na Human Security Act of 2007. This is in fact a new law, no? And it repealed and replaces the Human Security Act of 2007. This new law was signed into law by President Duterte last July 3, no? Almost a month after it was passed by the House. And it becomes effective last July 18 or for that matter July 22. Kasi ang sabi sa batas, magiging effective ito 15 days after its publication in the official gazette or in a newspaper of general circulation. Ang sinabi ng Department of Justice, on the day that President Duterte signed this, it was also uploaded and published in the official gazette but online. No? And pero sabi ng iba, ng mga abogadong iba, dapat ibabase ito kung kailan yung printed copy lumabas. And the printed copy of the bill or the law 11497 ay lumabas lang noong June 6. So but nonetheless, ibig sabihin habang nag-uusap tayo ngayon, effective na ang new terror law, no? At pwede na tayong makasuhan ng terrorism kung gugustuhin nila. So bakit ba natin nilalabanan itong terror law? No, we will present three major reasons, no, bakit natin ito nilalabanan. Una, walang pangangailangan na i-railroad ito ng Kongreso dahil nabanggit ko na nga, ang problema natin ngayon ay isang krisis na pinalala pa, no? Before pa man na nagka-COVID-19, mas may hinakaharap na tayong krisis at pinalala lang ito ng pandemya ng COVID-19. Kaya dapat ang katugunan dito ay pang-ekonomiya at dahil nga sa COVID-19 solusyong medikal at pangkalusugan, no? So walang pangangailangan na iratsada ito. Pangalawa, tinututulan natin ito dahil tahasan itong paglabag sa ating saligang batas or constitution and constitutionally guaranteed rights, no? And there is also a fear that this will be used by President Duterte to further repress his critics, the political opposition, and even ordinary people. And finally, tinututulan natin ito because it is not true as presented by its supporters, no, or mga authors nito, that there are genuine safeguards in this new terror law. So isa-isahin ko yan, no? Bakit sinabi natin walang pangangailangan? Yung sinasabi nilang gera against terrorism, no? Kahit noon pa man, no? Kahit wala pa itong terror law, sabi nila on the run na yung mga maoti, yung mga ISIS, yung Abu Sayyaf, they're already on the run, especially after the nung magdeklara ng martial law sa Mindanao. So they are already on the run. On the other hand, ang mga revolutionary groups naman like the New People's Army, sabi ng state security forces, sabi ng government, they're already losing steam, no? In fact, thousands and upon thousands yung nagso-surrender, no? And besides that, itong mga sinasabi nilang acts of terrorism na ginagawa ng mga Abu Sayyaf, Maoti, and ISIS, these acts are already penalized and punishable under then the Human Security Act of 2007 and even our revised penal code, no? Sa murder, destruction to properties, or kidnapping. So, why the rush? Kung meron ng mga kasalukuyan, mayroon ng mga batas noon, katunayan hindi nga nila fully na-implement yung batas na existing, no, even up to now. So bakit kailangan pa talagang gumawa ng panibagong batas kung sinasabing they are on the run or natatalo na yung mga kalaban nila? Sa tingin natin, there is basis for the fear of our people na the real purpose of the railroading of this new terror law ay gagamitin ito para sa crackdown ng mga dissenters, sa mga opposition, even ordinary critics, no, coming from activists, human rights lawyers, human rights defenders, the church, media, and even ordinary people, no? Kung maalala ninyo nitong mga nakaraan sa panahon ng lockdown or panahon ng quarantena, mayroong mga nag-post lang sa social media in different parts of the country, pinaghuhuli na, no? So the more na kung meron ng ganitong batas ay talagang this will be weaponized, no? Especially that ang reality under this present administration ay hindi ito wala itong tolerance, no? Intolerant ito sa mga dissenters, no? At talagang gagamitin nila mga existing na batas at lalo na itong mabangis na new terror law to further suppress the rights of our people. But more importantly, no, dito sa pangalawang rason bakit natin ito tinututulan, itong new terror law under the present administration, itong Republic Act 11497, ay talagang mabangis ito. Ikumpara mo the Human Security Act of 2007 which was repealed by this law. I'll go to some major provisions na lang, hindi ko na isa-isahin lahat dahil napakarami nila. Pero ang isa rito na dapat talagang labanan ay yung Section 29 ng batas. What is Section 29? Ito yung warrantless arrest and detention without charges for maximum of 24 days. Under our jurisdiction, pinapayagan naman talaga yung warrantless arrest, but that is not the general rule. That is only the exception to the rule. No? The general rule still, under our Constitution and under our laws, dapat mayroong warrant, no? Kung huhulihin ng isang tao, or even if isi-search, no? Yung property ng isang tao. But here, in Section 29, pinapayagan ang warrantless arrest by the mere say-so of not the court, hindi korte, but by the written order of the Anti-Terrorism Council. Ano itong Anti-Terrorism Council? Ito yung konseho na pinapayagan dito sa batas na ito na para siyang merong judicial power, no? Na mag-issue ng written order directing the police, the military, and other law enforcement agencies na hulihin ng isang taong suspected, no? Please take note of the term suspected of committing any of the acts enumerated in the law. So suspetsado ka pa lang, no, pwede ka nang hulihin, no? At ang nagpahuli sa iyo ay hindi naman korte, at ang masaklap, pwede ka nilang i-place under detention for a period of 14 days and a maximum period of 24 days, no? 14 plus 10 days. So ito ay tahasang paglabag talaga sa ating konstitusyon, dahil sa ating konstitusyon, sinasabi rito na kahit sa panahon ng martial law, no? Pakatandaan po natin, kahit sa panahon ng martial law, ay hindi naman suspendido ang ating mga karapatan. At kaya nga, kahit sa panahon ng martial law at kahit sinasabi na the privilege of the writ of habeas corpus is suspended, sinasabi doon, a person arrested or detained shall be judicially charged within 3 days. Otherwise, he shall be released. So isipin po ninyo, martial law na nga, pero sinasabi ng ating saligang batas, pag hinuli ka na walang warrant, dapat sampahan ka ng kaso sa loob ng 3 araw. Otherwise, kailangan kang pakawalan. Pero dito po sa Section 29 ng New Terror Law, pwede kang ikulong nila, no? Ng hanggang 24, maximum of 24 days. No? Next na provision na kailangang ipabasura rin natin, no? Of course, together with the entire law, is itong Section 34, no? Sinasabi sa ating saligang batas that we have the right, no, to travel kung saan natin gusto, save for some restrictions, no? Halimbawa ngayon, nasa health emergency tayo, there are restrictions sa ating travel, but in general, karapatan nating pumunta kung saan natin gustong pumunta. Pero dito sa Section 34, our right to travel is further restricted, no? Kahit halimbawa nasampahan ka na ng kaso, alam mo namang walang basihan yung kaso na yan, kaya nag-file ka ng petition na makapagpiyansa ka, no? Dahil alam mo yung mga sinasabi nilang terrorist acts na ginawa mo raw hindi naman totoo, at kapag pinayagan ka na ng korte na makapagpiyansa, hindi pala ma-exercise mo pa rin fully ang iyong karapatan, dahil dito sa Section 34 sinasabi, upon application of the prosecutor, your right to travel will still be limited, no? Within the municipality or city where your case is pending. So halimbawa, si Sonny, sinampahan ng kaso, taga Metro Manila naman siya, pero sinampahan siya ng kaso doon sa Tawi-Tawi, no? So nag-file kaagad siya ng petition na makapag-bail siya, pumunta siya roon, apply siya ng bail, pinayagan naman ng korte dahil mahina yung kaso laban sa kanya. Pero dito sa Section 34, pwede pa rin mag-apply yung prosecutor na ilimit yung right to travel ni Sonny doon lang sa Tawi-Tawi. Hindi siya makakaalis doon habang ang kaso niya ay pending, no? So maliban pa dyan, maliban sa restriction to the right of travel, halimbawa naman ikaw ay pinayagan na makapagpiyansa, pwede kang ilagay on a house arrest. At ito, masaklap din, no? Kahit nasa house arrest ka, ang sinasabi rito, you are not allowed to use telephones, cell phones, emails, computers, the internet, and other means of communication with people outside the outside your residence, until otherwise ordered by the court. So, sa tingin natin again, no, violative ito sa karapatan natin na makapag-bail, no? Dahil pinayagan ka na nga magpiyansa, pero meron pa rin palang restriction na ilalagay doon sa iyong piyansa. Hindi ka makaalis doon sa lugar kung saan na pending yung kaso mo. Pero kung nasa house arrest ka naman, hindi ka rin payagan makipag-communicate sa mga tao outside of your residence, no? So worse, halimbawang pending yung kaso mo for 2 to 3 years or how many years, ikaw ay nakakulong lang sa bahay mo, no? Or nandoon ka lang sa Tawi-Tawi kasi hindi ka na makapag-travel outside of that place, no? So parang nagiging kalakaran under the Section 34, ikaw ay presumed guilty until proven innocent. No? Nabaliktad na ngayon ang doktrina na dapat under our constitution, a person who is accused of a crime is presumed innocent until proven otherwise by a competent court. No? And more importantly, kung papayagan natin itong section 34, it will encourage more trump-up charges. No? Mga gawa-gawang kaso na kahit walang ebidensya or kahit mahina ang ebidensya, isasampa nila para lang ma-restrict ang isang tao sa kanyang bahay o doon sa lugar na kung saan doon nila isinampa yung gawa-gawang kaso. Next to Section 34 ay itong isa pang masahol na section, Section 25. Under the old law, the Human Security Act of 2007, dalawang paraan lang kung paanong makonsider ang isang tao or isang asosasyon or grupo na sila ay mga terorista. And that is one, yung designation by the United Nations that can be adopted also by the domestic jurisdiction or local jurisdiction ng ating korte. Pangalawa, yung proscription, the process of proscription. Ano pong ibig sabihin nito? Yung Department of Justice will file a case before the court at maghahain siya ng kaso doon, magpipresenta siya ng ebidensya. Yung kanyang sinasampahan ng kaso ay pwede rin magpresenta ng kanyang counter evidence at titimbangin ito ng korte. At the end of the day, the court will decide kung ang isang tao o isang grupo o asosasyon ay terorista nga. Pero dito sa Section 25, dinagdag nila ito, siningit nila ito sa Senado at the last minute. No? Binigyan ng kapangyarihan ang Anti-Terrorism Council to designate a person, groups, individual groups, person, organizations, or associations as terrorists upon a finding only of probable cause. Ano pong ibig sabihin dyan? Nagdududa lang sila. Meron silang parang pinagbabasihan daw na ikaw ay terorista or ang iyong grupo, halimbawa ang Philippine Medical Students Association, ito ay mga terorista ito. They can already designate, no? Kahit na walang ebidensyang pinisenta sa kanila, no? Na ikaw, ang isang tao or ang isang asosasyon ay terorista. Anong implication nito? If you are designated as a terrorist, no, yung assets mo ay pwedeng i-freeze ka agad ng Anti-Money Laundering Council. All your officers and members can be arrested in conjunction with Section 29 kanina na nabanggit ko na ang Anti-Terrorism Council can issue a written order for the arrest of a person suspected of being a terrorist. No? So, napaka mabangis po ng batas na ito. Can you imagine, hindi naman korte pero binigyan ng kapangyarihan o poder na mag-exercise sila ng judicial power. No? So ang Anti-Terrorism Council ay lumalabas para siyang hunta. No? Is part siya ng executive dahil ang mga members nito ay mga cabinet members, makaramihan ay mga ex-generals, pero nag-exercise siya ng judicial power by designating a person or individual as terrorist, plus nag-exercise din siya ng quasi legislative power dahil naglalabas siya ng mga policies, orders, supposedly to implement the anti-terrorism campaign of the government. Now, next to Section 25, ang isang, siyempre, ang pinakabuod nitong terror law ng present administration ay yung very vague and very broad definition of what terrorism is. No? And under the old law, yung Human Security Act of 2007, the definition of terrorism is based on yung tinatawag nating predicate crimes. Ito yung mga crimes and offenses already defined under the revised penal code or under a special law. No? Pero dito, sa Section 4, gumawa sila ng mga maraming bagong krimen. No? At ang definition ay hindi na nakabase doon sa predicate crimes. No? At dito sa Section 4, even the mere intention of a person is already nasa jurisdiction din ng Estado, nasa law enforcement agencies. No? Kung ano yung intention mo, ay sila rin ang magdesisyon. Whether terorista ang ginagawa mo ay an act of terrorism or not. No? For example, Section 4, letter A, sinasabi dito, acts of terrorism, when a person is engages in acts intended to endanger a person's life. Napaka-vague nun, no? Acts intended to endanger a person's life. What are these kind of acts? Pwede bang by mere verbal that can also endanger the person's life, or physical acts, no? But more importantly, even your intention, because ang sabi dito, acts intended to, no? Sila rin ang magdidesisyon kung ano yung intention mo. So the definition of terrorism under this new law is again very vague and broad, and it violates due process. It even violates freedom of expression, including freedom of the press and other constitutional rights. No? Dahil nga dito, kahit magpo-post ka lang sa social media, for example, your intention will be interpreted by the law enforcement agencies that ito ay part sa, these are acts of terrorism na penalized under the law. And finally, Section 7, no? Pinalawak nito yung paninikpik or surveillance ng under this law. It used to be that only ang surveillance ay pinapayagan lang doon sa Human Security Act of 2007 for 30 days. But dito ginawa na nilang 60 days yung acts of surveillance, ano? And dahil may mga bagong crimes or offenses na ginawa rito like acts of threatening, planning, training, facilitating, proposing, and even inciting to terrorism, ay mas dumadami ngayon ang mga individuals or persons or groups that can be subject to surveillance. And finally, gaya ng nabanggit ko, there are no real safeguards in the new terror law. Palagi binabalik-balik nila, no? Kung hindi kayo terorista, kung hindi kayo supporters ng mga terorista, kung wala kayong ginagawang masama, wala kayong dapat ikatakot dito sa new terror law. Siguro ang atin na lang alalahanin noong 2016 nung nilunsad nila yung campaign against drugs, no? Yung Tokhang. Ang sabi ng pamahalaan, kung hindi kayo addict, kung hindi kayo pusher, kung hindi kayo drug lord, huwag kayong mag-alala, hindi kayo dapat mabahala. But we just have to remember that after that statement, halos ilang libo na ang napaslang, no, sa campaign against drugs. At napakaraming mga inosenteng napaslang din, si Kian de los Santos for example. No, so hindi ho natin pwedeng panghawakan yung mga sinabi nila na wala kayong dapat ikabahala. In fact, napakarami na nating batas supposedly that protects the human rights. Meron tayong batas on against law enforced disappearance, against torture. Ang Pilipinas ay signatory sa napakaraming international covenants on human rights and international humanitarian law. Pero bakit hanggang ngayon napakaraming paglabag sa karapatang pantao? Just last month, the Office of the High Commissioner on Human Rights ay nag-report sa United Nations at sinasabing malawak, laganap pa rin ang paglabag sa karapatang pantao dito sa Pilipinas. Kaya again, hindi pwedeng panghawakan yung mga statements ng mga authors and even the spokespersons of the government and even the President himself, no, na hindi dapat mabahala. Palagi nilang sinasite yung last provision sa Section 4 ng batas na sinasabi doon, the terrorist acts under this law shall not cover legitimate exercises of the freedom of expression to peaceably assemble, including engaging in advocacy, protest, dissent, or mass action. Pero kung basahin mo kumpleto yung batas na yan, or yung provision na yan, dinugtong pa rin nila sa dulo, where a person that does not have the intention to use or urge the use of force or violence or cause harm to others. So ibig sabihin, kahit peaceful yung ginawa mong protesta, peaceful yung pag-strike, no? Peaceful yung ginawang pag-post mo sa social media, ang final, no, na magdedesisyon kung ano ang intention mo ay sila pa rin, no? At pwede nilang i-interpret ito na acts of terrorism. Finally, kung totoo talaga yung gusto nila na sinabi nila na gusto nilang magkaroon ng safeguards, bakit tinanggal nila yung provision sa Human Security Act of 2007 na penalizing yung nagpapakulong ng mali, no? Dahil sa Human Security Act of 2007, there was a provision there that if there is wrongful imprisonment sa isang inosenteng tao, ay magbabayad yung responsable nito ng 500,000 penalty a day, no? Every day na mali yung pagkakulong. Pangalawa, meron ding provision doon na hindi pwedeng suspendido ang provision ng Human Security Act of 2007 1 month before the election and 2 months before the election para hindi ito pwedeng magamit ng mga nasa kapangyarihan, lalong-lalo lang na nasa Malacanang sa panahon ng election. But these provisions, protected provisions, were already removed in this new terror law. So again, hindi totoo na merong mga safeguards, no, sa batas na ito. So in general, ang batas na ito ay talagang mabangis, no? At this will be weaponized by the present administration, an administration that is very intolerant for dissent, no? Especially sa panahon na ito na grabe ang krisis na kinakaharap ng ating bansa, no, na pinalala pa nga nitong pandemya ng COVID. Nakita naman natin itong nakaraan nung magsimula ang lockdown, March 17 to April 17, 30,000 more or less ang pinaguhuli kaagad. Wala pang terror law yon. Pero ngayon, meron ng terror law, ina-expect natin that this will really weaponize, no? Dahil lumalakas at lumalakas yung dissent, hindi lang ng mga the usual suspects nila, even ordinary people. So this new terror law is, again, ito'y act of state terrorism at kailangang labanan natin ito, i-oppose natin. At naniniwala tayo na tayo ay magtatagumpay na mapabasura ito. As we speak now, there were already almost 20 cases pending before the Supreme Court, and marami pang maghahabol na magsasampa ng kaso sa Supreme Court. Lumalawak ang mga grupo at mga bilang, mga simbahan, academic community na nag-o-oppose dito. At kailangan labanan natin ito sa lahat ng larangan, sa korte, sa kongreso, at maging sa kalsada para eventually ay mabasura itong terror law ng kasalukuyang administrasyon. Maraming salamat po at magandang hapon.
Thank you, Congressman Zarate. The discussion of the anti-terrorism law is important because it affects us all and is relevant contextually to the response of our government in this pandemic. Again, this puts into context and perspective about how health is political. So we have heard all three of our speakers. And now it is time for our open forum. So thank you for your questions, and we will now be hearing from our speakers. Once again, I will be reading out questions, and just to check, nandyan pa ba kayo, Dr. Delen?
Nandito pa ako.
Okay.
Yes, Bobby.
Yan po.
May
Nandyan po.
tanong ba?
Check lang po kung nandyan pa po kayo. Sir Sonny
Dito
Africa.
pa naman.
Ayun po. And dyan po si Congressman Zarate. So, yung first question po natin is from Joss Nugid. I hope I'm pronouncing it correctly. From the Ateneo School of Medicine and Public Health. And this question is directed to Doc De La Paz. Doc De La Paz, how do you distinguish mass testing and targeted testing? Citing Sir Lucas' reason that there's already a targeted testing, that's why there's no need now for mass testing. So Dr. Lapaz's question is about how can you distinguish mass testing and targeted testing daw po?
Sinasabi naman natin na free mass testing, lahat ng mga may chances of being infected, sila yung dapat na inuuna tinetest kasi sila yung may possibility na pwedeng manghawa. Yung targeted testing na sinasabi ng government is that directed only to those who are symptomatic and in areas where the transmission is high. But what we're saying here, it should not just be limited to them because ang daming asymptomatic, ang daming mga cases na hindi talaga na alam natin na may possibility na they are carriers and they can be transmitting the illness, but because they're not aware of the situation of asymptomatics and also because many of them really have to go out to find work, sila yung mga dapat na inuuna ring i-test kasi sila yung high probability na makakapag-infect kasi andun din yung hindi nila alam na carrier sila. So hindi lang dapat dun sa mga symptomatics ang tina-target ng testing. And this should be free testing because people are afraid to be tested kung magbabayad pa sila.
Thank you po, Doc Delen, for your answer. And I hope, Kuya Josh, that answers your question. And we have another question from Mika Salungit of the University of the Philippines, Manila. And this question is for all speakers. How are public health practitioners vital in the health landscape of our country? I guess we should start with Sir Sonny Africa po. How are public health practitioners vital in the health landscape of our country?
Well, I think well-established ni Dr. De La Paz, if we're referring to public health practitioners as the government health practitioners, I think they're that indisputable core of health response or healthcare in the country. I think there's hindi man philosophical, may strategic problem with relying on privatized health practitioners to provide healthcare. Because if it's privatized, there's always going to be a profit premium. There's always going to be a bias for running hospitals on profit-seeking terms. And I think it's the very nature of healthcare. It is expensive. It needs a social investment to provide for all. If it's provided on market-based terms, it's always going to be too expensive because of the profit premium, and it's always going to be too insufficient because for the private sector, excess capacity is idle capital. Idle capital means lost profits. So I think the pandemic is a good example of that because over half of our health system now is actually private. I think that's the single biggest reason why we don't have enough excess capacity for a pandemic because the private hospitals never wanted that excess capacity because that means they're losing money. And it's too late now in the middle of a pandemic to try to sort of retool the private sector to suddenly become more publicly oriented. So I think that's a very good example for me right now of why public health practitioners and the public health system is the indisputable core of any sort of healthcare system for the country. I'm sure Doc Delen has much more reasonable things to say, but from an economic perspective, that's our view.
So thank you po, Sir Sonny Africa. Doc Delen, let's hear po from you as stated by Sir Sonny po. Maybe you have another perspective po as somebody who works in the public health sector.
Tama naman yung sinabi ni Sonny kasi ito yung natin kung public health system versus private health system. Kasi yung public health system, dapat yan yung tinutugunan ng gobyerno. And the government has the prime responsibility because it has the mandate and it has the resources. Our taxes are being paid by the people, supposedly to be utilized for social services. And because we have the money already paid for by the people, it's just the right of the people to experience and parang matamasa yung epekto nitong taxes na binabayad nila by virtue of an improved and well-equipped public health system. Para kung sakaling magkasakit sila, ang pupuntahan nila yung public health system at meron silang aasahang mabibigyan sila ng services. Kasi pag pumunta sila sa private, definitely it would mean out-of-pocket expense, magbabayad sila. Kasi yung private sector, dapat lang naman din mag-charge sila kasi wala silang pagkukuhanan ng kita nila kung hindi sila maniningil. Pero dahil sinasabi natin ang kalusugan ay isang karapatan ng mamamayan at ito ay responsibilidad ng pamahalaan, dapat ang pamahalaan mas pinapalakas niya yung public health system. At ito yung magbibigay solusyon dun sa mga problema ng mamamayang Pilipino na karamihan ay kapos na at walang kapasidad magbayad ng private.
Thank you po, Dr. Delen. How about you po, Sir Congressman Carlo Zarate? Do you have another perspective to
I certainly agree with Doc Delen and our economist, si Sonny. At ito talagang pandemya ng COVID exposes, nagbukas nung katotohanan kung gaanong kabulok ang ating sistema sa health. At hindi kasi ibig sabihin na malaki ang budget, for example, sa health, ay talagang napupunta ito doon sa pangangailangan ng ating mamamayan. Halimbawa, ito, nakita natin ito ngayon. Taon-taon binabawasan ng pondo ng mga pampublikong ospital. Pero lumulobo yung pondong subsidy doon sa PhilHealth. Sino bang nakikinabang sa insurance type na health care system? Mga private din. At ito, sumabog na naman ngayon. Nagkakaroon ng usapin ng korupsyon dyan sa PhilHealth. So, again, from the perspective of legislation, kailangan tingnan din yan. Dahil pwede kasing sabihin na hindi, totoo, pinaprioritize namin ang health dahil malaki ang budget niya. Pero in reality, hindi totoo yon dahil nagkakaroon nga ng different levels of corporatization sa ating mga pampublikong ospital ngayon. At marami sa ating mga public health practitioners ay nawawalan na rin, umaalis na rin sila dahil hindi na nakakayanan ng pondong binibigay sa kanila ng pamahalaan. So, I guess yun yung take ko dyan sa tanong na yan. Maraming salamat.
Thank you po, Congressman. So I love how we all just have different speakers who can offer to us different perspectives and insights, showing us truly how multifactorial health is. So we have another question for all speakers. from Keith Serrano of the Ateneo School of Medicine and Public Health. From our speaker's perspective, can they categorically say that the current admin's response is negligence rather than incompetence? Why or why not? From our speaker's perspective, can they categorically rather than incompetence? Why or why not? Let's start po with Sir Sonny.
Ako?
Sir Sonny.
Sige na nga. Siyempre, hintayin ko sana si Kong Kaloy. But from our perspective, I think it's primarily, of course, they're being incompetent. I mean, I think that's guaranteed. But I think more than that, they're being negligent because may pattern tayo eh. I think important yun nabanggit ni Kong Kaloy. Hindi ko alam if people are aware, for the last 3 years, the budget for health infrastructure, hospitals, and health centers has been falling. So kumbaga, if you want a simple indicator of where are we now, how low our capacity to respond is, it's because it's coming on the heels of, despite ang dami-dami sinasabing, build infrastructure. Di ba, what the F? If you're spending so much for infrastructure, why are you leaving behind our health infrastructure and our education infrastructure? So parang, it's gross negligence na yon, even coming to the pandemic. In entering the pandemic ngayon, again, the numbers will show the government isn't spending enough to respond to the health situation. The government isn't doing enough to actually contain the virus, and it's not doing anything to help the people. So talagang, ayoko magsalita, pwede si Kong Kaloy na lang. Perspective namin, we'll just let the numbers speak for themselves. They've been negligent coming into it, and they're doing very poorly in the years to come.
Sige po, let's hear from Congressman.
Criminal negligence. No? It's really a criminal negligence, if I may say so. Just a perspective, last March 10 before the lockdown, nagkaroon kami ng hearing sa Congress, sa Committee on Health. I think nandoon siguro sina Doc Dela nito. Ang aming resource person is Secretary Duque. No? At by that time, March 10 na yan, ang parang napaka-nonchalant pa rin ng ating administration at that time. No? In fact, masyado nilang minaliit yung problema. No? Parang nagbibiro pa sila. Sampalin ko lang yan si virus na yan or anong mga statement nila. And categorical, tinanong ko si Secretary Duque, yung pangangailangan ng mass testing. No? At by that time, ayaw pa niya mag-commit. No? Hindi pangangailangan. No? Then, tinanong din natin sa kanya, di ba dapat nag-declare ka na ng isang state of epidemic, no, under Republic Act 11332? Dahil nung January 31, meron nang namatay, no? At yung napapatunayan na itong virus na ito ay talagang deadly. Sa China, marami nang namatay, but anong sinabi nila at that time? Mahirap yan dahil yung ating diplomatic relations, especially with China, maapektuhan. Maraming mga turistang pumupunta rito. So that alone is an Exhibit A, Exhibit B, Exhibit C of how negligent and even criminally negligent sila, no, na pangalagaan yung interest ng mamamayan kaysa inuuna nila yung wag magalit o wag masira yung ating diplomatic relation. And merong consequence yun na dahil hindi nag-declare immediately ng state of epidemic under 11332. Anong consequence nun? Hindi nakapaghanda. Hindi tayo nakapaghanda. Nag-lockdown na lang ng March 17, pero hindi handa ang ating healthcare system, ang ating mga LGUs, no? Dahil kung maaga sana siyang nag-declare, nung January 31 nag-declare siya, ay di nakapamili na, nagkaroon na ng mga PPE, hindi lang nagkaroon na tayo ng testing machine. By that time, March 10, ang testing machine natin, ang test ay ginagawa pa ata sa Australia at that time. No? So, if that is not criminal negligence, I don't know what it is. No? Talagang malaki ang panagutin ng administrasyong ito dahil sa tuloy-tuloy pa rin na pagtaas ng numero ng mga infected ngayon at parami pa rin sa ating mga kababayan. ang namamatay, especially during the first months of the COVID-19 pandemic. Ang ating mga frontliners, ang ating mga healthcare providers, sila ang sinuong sa giyera na wala silang dalang gamit, no? So talagang criminal negligence yan, if I may say so.
Thank you po, Congressman. And before we move on to Dr. Delen's input po, naka-raise hand po kayo, Sir Sonny.
Oo.
Ayun.
Sige. May quick dagdag lang ako. I think yung tama buti na sinabi ni Kong Kaloy, I think ang pinakatama talaga yung isipin ng criminal negligence. Kasi sa totoo lang, yung incompetence actually comes from a long record of negligence. Kumbaga, you build up competence by doing something. If you're privatizing the health system, you're actually ensuring incompetent yung health system natin because you're not practicing, di ba? You learn by doing. So I think, sobrang nag-reason lang ako to Cesar point na, oo, incompetent talaga, may problema na gano'n. But tumbukin natin, because of ina-share ni Doc Dela na long decades of neoliberalism in the healthcare system, yun ang ugat kung bakit incompetent yung response natin. And right now, ang kagat ng problema, yung criminal negligence na ating government.
So, thank you po for that, Sonny. Dr. Delen, do you have any other input po for that question?
Sinususugan ko yung sinabi ni Sonny at saka ni Kong Kaloy tungkol dun sa pagkukulang ng response ng government. At yung pagkukulang ngayon, nauugat yun dun sa mga hindi nila ginagawa noon pa. Bakit nila hindi ginagawa? Dahil hindi nila alam? Or dahil nagpapadala sila sa ibang priorities? For example, yung health as a right, ang tagal-tagal na niyang issue, at yung government has the prime responsibility, ang tagal-tagal na niyang issue. At yung issue ng social health is multifactorial, affected by social, economic, matagal na rin niyang na-establish, and DOH is a signatory to all of these documents. So dapat alam nila yan. So bakit hindi nila ginagawa? Well, I don't know if it's really incompetence, but it's more of a subservience to the political dictates of our government. So, kagaya ngayon sa IATF, dapat sila nangunguna kasi health response dapat ito. Bakit sila nagpapadala sa militaristic response? Bakit sila sumusunod dun sa mga general at mga ibang mga vested interest ng ating gobyerno? At yun yung nananaig sa response. So para sa akin, it's both incompetence kung hindi nila nakikita na hindi ito dapat at negligence kasi hindi nila tinitignan ano yung kapakanan ng mamamayan.
Thank you po, Dr. Delan. So, we have a question in relation to that question that was just raised from Anonymous. Can Dr. Duque, in his capacity as both a physician and Secretary of Health, be criminally charged of medical negligence? We can start with Congressman Zarate as this is a legalistic discussion.
Well, kailangan pag-aralan yan, no? Kung ano yung mga direct and indirect. Of course, mayroon talagang responsibilidad si Secretary Duque dyan dahil siya ang ating kalihim ng sa pangkalusugan. Dapat talaga siya yung nasa unahan dapat ng usapin na ito. Pero nakita naman natin, no? Parang nilagay lang talaga siya dyan sa tingin ko para may masisi, no? Pagdating sa panahon. Dahil talagang nananaig, gaya ng nabanggit ni Dr. Delen, nananaig talaga yung militaristang solusyon dito. No? At nasa pinakamahabang lockdown na tayo, pinakamahabang karantina, para ngayon pa lang nila, ay tama pala, mag-mass testing tayo, ay tama pala, kailangan mamigay tayo ng libreng mask. No? But before that, before nila na-realize na mamigay pala tayo ng mask, lalo na sa mahihirap, ang prescription nila, hulihin ang hulihin ang hulihin. So, again, going back to the question, that when, siyempre, there will always be a time for all of these things, no? That they have to be accountable sa nangyayari ngayon. Dahil, alam nyo, ano lang naman yan, fleeting lang yung nasa posisyon ka, walang forever dyan sa kapangyarihan, sabi nga nila, no? Public office is a public trust, no? And you have to be accountable sa ginawa mo habang nasa katungkulan ka, no? At hindi kasi, anong nangyari kasi ngayon, hindi lang naman ito merong nagkasakit, no? Merong nawalan ng trabaho. Merong nawalan ng mga buhay dito. No? At dapat merong managot kung merong nangyaring pagkukulang, negligence at kapabayaan dyan.
So, thank you for that input, Congressman Zarate. Do we have an input from Dr. Delen po?
I think we have to study that further, tulad nga na nabanggit ni Kong Kaloy, kasi ang definition pa ng medical negligence ngayon sa legal med, I think, is nakatuon sa care of the patient. So, kung titingnan natin yung buong Pilipinas as pasyente, magkakaroon ka ng ganyang analogy. Pero sa legal med sa ngayon, I think it's really directed more at an individual patient in terms of medical negligence. I'm not sure. I have to review on that. So if we will expand the meaning of medical negligence to beyond a patient, to looking at the context of populations, to looking at the context of whole communities and the nation, perhaps it can be. If that can be broadened in that definition, then make responsibility and culpability si Secretary Duque dyan.
Sir Sonny, thank you po, Dr. Dan. Sir Sonny, may madadagdag po pa kayo doon?
Wala na si Sonny.
Ay, nawala po siya. Sige po. Pero meron po tayong another anonymous input, another anonymous question, a follow-up actually, probably from the same person po. May nagpe-press ba ng charges sa kanya lang alone? I think kanya refers to Duque po here, Sir Duque. Does it extend to the president bilang alter ego niya po, if so?
Again, at this point, sabi ko nga, dahil yung mga legal cases na ganyan ay dapat pag-aralan talaga yan. Dahil pag for example, kung criminal charges, ay kailangan tingnan kasi yung personal responsibility, no? Yung participation ng isang tao, dahil ang criminal cases dapat ma-establish mo ang partisipasyon ng isang tao. But siguro in general, no? Dahil nga gaya ng nabanggit ko kanina, ang ating mga kawani ng pamahalaan at mga halal na opisyal ay nandyan, hindi dahil sa kanila yung posisyon na yan. No? Trustee lang kami dyan. Meron kaming pananagutan sa mamamayan. Kaya kung merong mga katiwalian at merong pagkakamaling nagawa habang nasa posisyon at habang kawani kami ng pamahalaan, ay dapat maging accountable and responsible kami. No? At in several instances, even if you are no longer in position, no, ay pwede kang sampahan ng kaso dahil sa mga ginawa mo while in office. No? And dapat yun ang pakatandaan ng ating mga kawani at mga halal na opisyal na hindi pag-aari natin ang posisyon. Kaya dapat maging maingat tayo na walang nasasagasaan, for example, na karapatan ng ating mamamayan habang tayo ay nasa posisyon. So siguro in that sense, no, sa prinsipyong yan, magkakaroon talaga pagdating ng panahon ng paniningil at accountability sa ating mga opisyal.
Thank you po, Congressman Zarate. Dr. Delen, may input po ba kayo?
Sa ngayon, wala pa naman akong alam na talagang nagpa-file ng case against Secretary Duque for criminal acts or criminal negligence. Wala namang ganung actual case. But what we're calling for is the resignation of Secretary Duque because of all these things that are happening that we believe he's not able to address adequately, and he's accountable for all this negligence. So the best thing is for him to resign.
Thank you po for that. So we have a question din po, another question for all of our speakers from Angel Season of Our Lady of Fatima University. Sa dami ng tax at utang ng government ngayon at dahil effective na supposedly ang Universal Healthcare Law, where and how does Universal Healthcare Law come in sa ganitong situation? Especially after the news of a resignation of a PhilHealth official due to massive corruption within, knowing that PhilHealth will be a major payer or purchaser of Filipino healthcare. So again, I'll repeat the question po. The question is for all speakers from Angel Season. Sa dami ng tax at utang ng gobyerno ngayon, at dahil effective na supposedly ang Universal Healthcare Law, where and how does Universal Healthcare Law come in sa ganitong situation? Especially after the news of a resignation of a PhilHealth official due to massive corruption within, knowing that PhilHealth will be a major payer or purchaser of Filipino healthcare. Kong Zarate. Maybe we should start with you po.
Yeah. Actually, malaking usapin talaga yan, yung UHC, no? Dahil nung pinagdidebatehan namin yan sa Kongreso, hindi namin sinuportahan yan, no? Dahil sa tingin namin, napakalaki pa ng problema nga ng kasalukuyang sistema ng ating healthcare system, no? Tapos gagawa ka na naman ng bagong batas na hindi mo pa, halimbawa, usapin ng korupsyon sa loob ng PhilHealth. Dahil ang buod pa rin ng universal healthcare ay ibibigay mo yung napakalaking pondo doon sa PhilHealth. No, sila pa rin yung pangunahing institusyon na masahol pa rin at malala ang problema at nakita nga natin ito nitong nakaraan ngayon. Pangalawa, at yung kakapusan talaga sa pondo, no? Ang aming panawagan pa rin talaga kung ay sa halip na yung malaking pondo ng Department of Health ay napupunta diyan, ay dapat dalhin na lang muna ito doon sa ating mga pangunahing mga ospital, no? Dagdagan yung kanilang MOOE, yung kanilang pag-hire ng mga regular, yung mga healthcare providers natin, mga nurses, mga doktor, taasan yung sweldo nila, sa halip na mangangako ka ng mangangako na misnomer kasi ang universal healthcare na yan. Sa totoo lang, hindi naman talaga universal, no? Dahil hindi nga rin nakukover lahat. So there is now a move, no, to review that, no? Especially ngayon nga nakita natin na hindi rin nakaka-responde, no, kahit dito sa usapin ng pandemya ng COVID. Tapos napakaraming pondo na nasasayang lang, no, taon-taon na natatanong natin yan sa PhilHealth, no. Yan yung isang problema ngayon na kinakaharap natin. Tapos tama yon, ang daming pinapataw sa atin ng mga dagdag buwis, no, pero sa kabilang banda, nabanggit ito ni Sonny kanina, no, yung sinabi niyang create yung Corporate Recovery and Tax Incentives for Enterprises Act. Tayong mga ordinary mortals, pinapatawan ng maraming buwis, pero yung malalaking korporasyon, binabawasan ang binabayad nilang buwis, no? So, diyan natin makikita yung priority ng administration, no? Tayong mahihirap, dagdag pasanin, pero doon sa mga malalaking korporasyon, bawas ang pasanin nila na sa halip na dapat sila yung aako sa responsibilidad, halimbawa, no, nitong pagpopondo ng ating pamahalaan. Kaya in the coming days, I will not be surprised kung talagang tutuloy-tuloy nila yung implementation ng universal healthcare. Ay uutang na naman tayo para mapunduhan yan.
Thank you po, Congressman Zarate. How about you po, Dr. Edelina?
Una, balikan natin yung concept ng universal healthcare. When it started in about 2005 by WHO, the real essence was universal healthcare. Care. Ibig sabihin, pagbibigay alaga sa mga taong sakit. Pero along the way, nakita nila na ang hirap i-sustain kung wala kang pondo. So they now looked at insurance as the financing mechanism. So from the concept of universal healthcare, it became universal health coverage. Kaya lang pareho-pareho yung acronym, UHC. So when people talk of UHC nowadays, they think it's still universal health care, but actually the direction is already universal health coverage. So using insurance as their means of financing mechanism. So ito yung tinututulan namin mula sa pool. During the hearings of the universal healthcare law, we were already presenting our opposing views because we felt that it will not, if they will use universal health coverage as their main definition of universal health care, then it will not really provide support to the poor and those needed. So what we were asking for was the mechanism for funding health, public health at that, should not be insurance-based, but it should be tax-based. Kung ano yung binabayad na taxes ng mga mamamayan, i-allocate natin yan properly para mapondohan ang public health system, meaning the health centers, the municipal health offices, the public hospitals, district hospitals, provincial, all the way up to the national public health system. Dapat yan ang pinupondohan ng mga taxes natin. Kaso hindi kami pinapakinggan. Kaya pagdating sa batas na sinasabi nilang isa pang tinututulan namin dito sa Universal Healthcare Law, yung providing primary care, yung dapat mag-e-enroll ang pasyente with a primary care provider. At dito papasok yung mga private practitioners. So again, you're privatizing the health system, because while I don't have really, I do not really, I'm not against the private health system per se, but if you are utilizing them as the primary means of addressing your people's needs, which the public health system should be doing, ang nangyayari, tinataasan mo yung cost ng health. At therefore, yung PhilHealth, babayaran niya yung private entity na nagpo-provide ng services. And we know that the private entities will charge costs that are more than what is the actual cost. Kasi syempre dapat kikita sila. So ang nangyayari, yung pondo, imbis na bibigay mo sa pag-develop ng public system, mas ginagamit mo pa sa pagbabayad mo dun sa mga private entities, private practitioners, private hospitals na naging bahagi ng Universal Healthcare Law. So pinapasa mo ngayon yung pera doon, imbis na ikaw ang mangangasiwa at makapag-maximize ka ng pondo mo, ay naibabayad mo tuloy doon sa private sector. So itong mga ganitong mechanisms, ang nakikita namin hindi maganda dito sa UHC law. Kaya doon sa tanong na ito ba'y ang pondo ba ay mas magagamit, paano na yung pondo ng Universal Healthcare Law? Kung ngayon nga yung PhilHealth ay nagkakaproblema, kung yun ang main funding mechanism ng UHC law, paano mo patatakbuhin yan kung wala ka ng pondo sa PhilHealth? Samantalang ang laki ng pondo na binibigay sa PhilHealth, yung pala nauuwi lang sa kurakot. So ito yung sinasabi natin, tigilan natin yung PhilHealth, ibalik natin ang pagpupondo ng health sa public health system and scrap the UHC law. We are calling for a repeal of the UHC law because we think it's a misnomer, it's a deception to the Filipino people that it will give them better health services when in fact, it will privatize the health services more. Nasagot ba?
Opo. Thank you po, Dr. Delen. Both of our speakers gave very comprehensive answers, and we're down to our last two questions, guys. So kapit lang po tayo lahat dyan, and kapit lang po tayo sa ating speakers. Thank you so much for your time once again. So our next question, our second to the last question, is for Congressman Zarate. How are we to utilize the legal and judicial system given that the anti-terrorism law effectively erases the safeguards granted by the Constitution and by other laws? And what is the implication of the anti-terrorism law sa work po of the health professionals? Again po, how are we to utilize the legal and judicial system given that the anti-terrorism law effectively erases the safeguards granted by the Constitution and by other laws? And what is the implication of the anti-terror law sa work po ng health professionals?
Salamat doon sa dalawang tanong. Una, kailangan i-maximize pa rin natin yung ating judicial system. Kaya nga, nagsampa tayo ng kaso sa Korte Suprema dahil naniniwala tayo na talagang maraming busbus ng unconstitutional provisions itong new terror law, at gusto nating mabasura ito. As I mentioned earlier, no less than 20 or 15 to 20 petitions na ang nasa Korte Suprema. But of course, hindi tayo nagpapatali lang doon sa Korte. In fact, sa pagbubukas nitong second regular session ng Congress, isa sa binabalak natin, maghain din ng isang bill to repeal the new terror law, dahil sa mga rason na nabanggit ko kanina. And more importantly, kailangan ang boses na manawagan na ibasura ito ay manggagaling mismo sa mamamayan. Kaya ginagamit nga natin ang tingin ko nagbukas ito ngayon ng oportunidad, para mas mapaintindi natin sa mga kababayan natin, why are we opposing this kind of law? Especially in this situation that we are in the midst of a severe crisis. So nagbukas ito ng oportunidad, na mapukaw natin ang ating mga kababayan, ang ating mga kapwa-estudyante, ang mga medical students. Nasabi nila, mga medical students, nakakonsentrate lang yan doon sa pag-aaral nila, pero ito ay may implikasyon, kahit na sa mga nasa health sector, kung hindi natin ito mapabasura. So lahat na oportunidad na mapabasura natin ito, legal, extra legal, gawin natin hanggang sa korte man yan, sa kongreso at maging sa labas ng korte. Doon sa ano ang implication ng batas na ito, bakit kailangan natin itong ipabasura? Merong provision dito na it is also considered as act of terrorism, yung material support, no? And it's vaguely defined yung material support. At alam naman natin, halimbawa, kayong mga nasa medical sector, no? Ang daming pupunta sa inyo, nagpapakonsulta, nagpapagamot. Kailangan mo pa ba siyang tanungin, ikaw ba ay terorista? Bago kita gamutin? Ikaw ba ay miyembro ng isang terrorist organization? Hindi ba sinasabi sa Hippocratic Oath, no? Pag may pumunta sa inyo, may sakit, kailangan ng gamutin, ay ginagamot. Pero dito, pag ginawa mo yan, you can be charged, no? Under this terror law for giving material support to a terrorist organization or a terrorist person. So, talagang napakatindi ng implication nito. Maliban pa doon sa nabanggit ko na kanina ang mga karapatan nating magpahayag, no? To join an association, no? Na malalabag din. More importantly doon sa trabaho natin, dahil even giving professional services now can be considered as a terrorist act, no? If pabiyagan natin itong batas na ito. So I hope na-capture ko yung sagot doon sa tanong, ano, at napaliwanag natin.
So thank you po, Kong. And ano po, our last question is #Oust Duterte has been trending so many times recently. It has also been campaigned by progressive sectors since 2017. So with everything that is currently happening in our country, is #Oust Duterte the best call? And if okay lang po with Dr. Len, let's start po with Congressman Zarate kasi po paalis na rin din po siya. He has another speaking engagement daw po.
Well, tama yung sinabi mo, Bobby, no? Matagal na yan, #Oust Duterte. Of course, may different levels yan, no, ng panawagan ng mga mamamayan. But this only reflects na siyempre yung iba merong resign, merong oust, no? Kanya-kanyang iba-ibang level yan. But hindi mo ito makita in 2016. Hindi mo ito makita siguro in early 2017. But now, dahil nga sa talagang sobra na puno na rin ng ating mamamayan, ay nakita na natin, no? Yung dissent is now at the surface. Nakikita na natin, no? And kung ano man yung naabot na level, no, ng ating mamamayan, individually or collectively, ang importante ngayon na yung boses natin ay ating ipalabas, no? Maniningil tayo. We have to take this opportunity to hold this government accountable for all its misdeeds, negligence, incompetence in the past 4 years. No, hindi pwedeng manahimik tayo dahil ang nakasalalay dito ay hindi lang naman ngayon, kung hindi ang kinabukasan natin, no? At sa darating pa ng mga panahon, no, na nakita natin ngayon na kahit na sa krisis, ang pinaprioritize pa rin nila ay kanilang pang sariling interes, no? Kahit na nasa gitna tayo ng pandemya ng COVID, pinaprioritize pa rin nila ng mga politiko at ng mga nasa kapangyarihan yung kanilang sariling interes. So, eventually, ang mamamayan pa rin, nasa kamay pa rin ng mamamayan ang desisyon, no, kung ano ang tatahakin nating landas, no, para maiwas natin itong mga pagkakamali na nangyari ngayon sa ating bayan, itong mga tuloy-tuloy na kahirapan na dinadanas ng ating mamamayan, nasa kamay pa rin natin, no, ang solusyon para dito. So tuloy lang ang laban, at ako bilang magpapaalam na rin ako, salamat at bigyan ng pagkakataon na makapagbahagi ngayong hapon at nabuhay ang mga miyembro ng Philippine Society of Philippine Medical Students Association na kayo ay hindi lang nagpatali doon sa 4 na corners of your classroom at lumalabas kayo, pinag-aaralan ninyo ang mga problema, ang sakit ng ating lipunan. Maraming salamat po at magandang hapon sa ating lahat.
Thank you po, Congressman, and thank you so much for your time po. Let's move on po to Dr. Delen's answer for this. And Dr. Delen, may request po na may dagdag po, may follow-up question pa po yung tanong sa'yo doon. What's the role din po of med students and the youth po in this movement po of ousting Duterte po, if ever po? As a follow-up question po dun sa tanong kanina na if it's the best call for our country right now?
Sa haba na ng naging panahon ng panunungkulan ni Pangulong Duterte at wala namang malinaw na naging improvement yung mamamayan at yung bansa natin. Tulad nga ng sinabi ni Sonny, talagang patuloy na pababa yung ating economic situation. Tapos nakikita rin naman sa political situation, patuloy ang pagtaas ng mga political dynasties at yung pag-consolidate ng power ng mga nasa poder, yung mga families na nasa poder at yung patuloy na paglala ng economic conditions ng ating mga mamamayan. Ngayon pa sa pagpasok ng pandemic ay lumalala yung health situation. Nakikita natin na wala naman talagang naitulong pa itong pamahalang ito. And in fact, people are saying that they're really fed up with it and they're just waiting for change to happen at nang magkaroon naman ng panibagong sigla ang Pilipinas. Madalas nga nakikita sa mga chat groups, kaawa-awang Pilipinas, anong mangyayari sa atin. So parang people are getting hopeless. So it's really as Kong Kaloy said, it is the will of the people. Kasi yung people power na nangyari noong 1986 was also brought about by a series of events that really made the people be fed up with what was happening and for them to come up with their own demands and their own forms of action. So nagbi-build up yan ngayon, nakikita natin. Kasi makikita mo, people are really fed up. Even if you ask the ordinary person in the street, kumusta po ba yung inyong pagtingin sa kasalukuyang pamahalaan? Marami sa kanila talaga naghahanap ng mas maayos pang sitwasyon, at mahusay ng mga leaders. Kaya kung eventually people are really clamoring for that, then let the people decide. And if we put this all together, then it might be the best answer now because really even yung mga press conferences niya, nababasa ko rin eh. Ayoko na nga makinig kasi nabibuisit ako, makakarinig ka lang ng mga puro mura, puro denial, hindi naman nakaangkop sa realidad. Parang wala na rin tiwala yung mga tao. So if that is the case, then I suppose people would really want a change. And as to what kind of, how it's gonna happen, then that will evolve based on the people's level of organization and people's level of awareness. So kung ang mga medical students ay magiging bahagi nitong movement for change, kailangan ang mga medical students kasama muna doon sa pagpapaangat ng kamulatan ng ating mga mamamayan. Kailangan kasama tayo ang health sector sa pagpapataas ng kaalaman, ano ba ang nangyayari, ano ba ang dapat gawin, at ano ba ang ginagawa ng pamahalaan. Tumutugon ba sila sa mga dapat na pangangailangan. At sa proseso ng pag-raise ng awareness, sa proseso ng pagmumulat, ay mas mapapalakas natin ang mga organisasyon ng mga mamamayan. People's initiatives, people's collective efforts will come to fore and we will be part of this people's movement. Hindi tayo pwedeng hiwalay sa mamamayan. So ang mamamayan ang magtatakda kung ano ang mga gagawin at kung paano natin ito gagawin at sa gaano ka bilis na panahon. So bahagi tayo nitong movement na.
Thank you po, Doc Dylan. That's a very inspiring message po, Doc, especially for us, everybody here, med students, future healthcare practitioners who are listening right now. So thank you guys for all of your questions and thank you for our speakers for taking the time to join us today and to share your knowledge to our future healthcare practitioners. Unfortunately,
gusto ko lang idagdag. Gusto ko lang din sabihin sa mga estudyante na ako ay nag-umpisa ng aking activism nung estudyante pa ako. At ito ay binigyan ko ng malaking halaga ang mga ganitong pag-aaral. Kaya natutuwa ako kapag kayo yung nag-i-sponsor ng ganitong pag-aaral, ganitong talakayan. Kasi ito ang nagbibigay karagdagang kaalaman sa atin at o-open up ng ating ng ating minds na ang health ay hindi lang tinutugunan ng gamot o hindi lang tinutugunan sa ospital, kundi tinutugunan sa mas malawakang lipunan. Nag-umpisa ako ang estudyante, nagtuturo ako ngayon, malapit na ako mag-retire at natutuwa ako. Marami pa rin mga estudyante ang patuloy na ginagawa ito. Pero nalulungkot ako kasi napakatagal ng panahon na ginagawa natin. Hanggang ngayon, paulit-ulit pa rin. Sana sa panahon nyo, makakahanap na tayo ng totoong solusyon at totoong pagbabago. Binabati ko kayo at maraming salamat.
Thank you po again, Dr. Len. So of course, we need to be active, guys, because we will inherit tomorrow, basically. So we have to work on today. Again, thank you po to all of our speakers for joining us here today and for sharing your knowledge. And Sir Sonny po and Congressman Zarate, they had to go to other engagements. But since nandito pa rin po si Dr. Delen, let's call on PMSA's National Chairperson to award the Certificate of Appreciation for our speakers. Kuya Jed. Again, PMSA National Chairperson Jed Marcueto.
Kuya Angel, pwedeng pa ayan. So, the Philippine Medical Students Association, together with our 10 partner councils and organizations, present the Certificate of Appreciation to Dr. Delen de la Paz for being part of our panel of speakers and imparting her knowledge on the topic Criminal Ineptness and Negligence to COVID-19 Response during the Res IPSA LOQUITUR, the Philippine government's response to the COVID-19 pandemic webinar held this July 15, 2020, signed by PMSA Chairperson, Vice Chairperson, and Secretary General.
Maraming salamat.
Thank you so much.
Thank you very much.
Giving us a chance na marinig yung inyong napakagandang talk po, Dr. Len.
Maraming salamat ulit.
Thank you, Dr. Delen, and thank you everybody again for joining us here today. At our high, we had almost 300. We had 300 registrants, and we had almost 300 people engaging with us both in Zoom and in YouTube today. So for that, Dr. Delen, is it okay if magstay ka muna for a while so we can have a photo ops before Dr. Delen goes? So, sino pa yung magte-take ng photo? Pero everybody, I encourage everybody. Again, if kaya naman po ng data natin and ng connection natin, kung pwede po, let's turn on our video so we can take a photo.
Ako na lang mag-take ng photo. Sige po, bukas lang natin. Bukasan agad, puro mga bagong gising. Char. Sige po. Okay, for the first frame, kunan ko na po kayo. Okay, ready and 1, 2, 3. Sige po. For the next po, wait lang po. Okay. And for the last, puro mga nakapatay ang camera. Sige, okay na yan. Thank you.
So again, thank you everyone for being here. And before we end this program, let's hear words again from PMSA's National Chairperson, Jed Marcueto.
Hi guys, narinig ba? So first of all, gusto kong mag-thank you sa mga speakers, again kay Doc Delen ng Health Alliance for Democracy, kay Mr. Sonny Africa ng IBON, and Congressman Carlo Zarate ng Bayan muna Partylist. Tapos pangalawa, gusto namin ng PMSA mag-thank you sa aming mga partners. So yung mga binanggit kanina ni Kim, yung SNPH Student Council, CPH, um, sino ba yun? Wait lang, kailangan natin pasalamat. Everyone na nagpaabot ng suporta sa ating webinar, ayun nga yung ASMPH Student Council, Bicol University College of Medicine, De La Salle Medical and Health Sciences Institute College of Medicine, PLMCM, SLCM Council, Junelta School of Medicine Council, CPH Council, Dentistry, UP Dentistry Council, UFA-SC, and PLM Supreme Student Council. So thank you sa inyong lahat. And most of all, salamat dun sa mga umattend, mga nag-sign up na mga audience natin ngayon na mahigit yata tayo sa 300 dito sa Zoom and sa YouTube. So ayun, gusto ko lang sabihin na sobrang nandito tayo sa nandito tayo sa period ng life natin na masasabi nating malas tayo, na natapat tayo sa age na may pandemic, tapos kasabay ng pandemic ay merong martial law, pero may martial law na kaganapan. Pero syempre, hindi dapat tayo matakot dito, hindi dapat tayo nagpapasindak sa kung ano mang nangyayari sa atin. Kasi kapag nagpasindak tayo, kapag nagpatakot tayo rin yung talo, di ba? So nakita natin yung, na-explain naman kanina, yung negligence ng government sa COVID, sa pagsagot sa COVID pandemic, yung kawalan ng economic stimulus response program, at syempre yung pagkakaroon ng state terrorism sa forma ng anti-terrorism law. Ayun nga, na kahit na merong mga bagay na gano'n, kahit na nakikita natin na hindi talaga umaayon yung kagustuhan natin, kahit na tayo yung mga estudyante pa lang, hindi umaayon yung kagustuhan natin sa ginagawa ng government, it doesn't mean na wala tayong magagawa. Dahil kahit pa estudyante lang tayo, kahit bata pa lang tayo, kahit underage pa lang yung mga ibang mga umattend dito, or hindi pa nagka-college at all, or hindi pa nagme-med at all, it doesn't mean na wala tayong magagawa. Dahil hindi tayo kabataan lang, hindi tayo med student lang, hindi tayo student lang. Tayo ay kabataan. Tayo ay med student. Tayo ay mga estudyante. Ibig sabihin, tayo ay merong magagawa labas dun sa kung anumang traditional na sinasabi sa atin na mag-aral na lang tayo, na huwag tayo makikialam sa politics, na ang mga doktor ay nandito lang sa mga ospital, ang mga doktor ay malalaki ang mga sweldo, na mga med students ay nag-aaral lang, nakaganon lang yan lagi sa libro. Basagin natin yung notion na yon, dahil before tayo naging mga estudyante, before natin pangarapin na tayo maging doktor, at before tayo maging doktor at mga health professionals, ay mamamayan muna tayo ng Pilipinas. At meron tayong duty na tugunan kung ano man yung hinaing ng ating inang bayan, at yun yung lumaya tayo from hindi lang naman mga foreign na entities, kundi yung mismong mga tao na nagpapahirap sa mga mamamayang Pilipino. Kaya ayun, tama yung sinabi kanina ng mga speakers natin na dapat sa lahat na nangyayari ngayon, dapat may managot, dahil bilang mga health students, bawat buhay ng bawat isang Pilipino ay mahalaga. At nakikita natin na yung government negligence nila dun sa pagsagot ng COVID pandemic, at yung pagpasa nila ng mga anti-mamamayan na mga policies ay kasalanan sa ating karapatan sa kalusugan. Kaya dapat may managot. At sinong mananagot dyan? Siyempre, si Duterte. Kaya ang pinakamatalas na campaign ng ating sektor ay ang pagpapatalsik natin kay Duterte. Kaya naman, nananawagan ako sa inyong lahat na tayo ay sumama sa gaganaping People's SONA o People's State of the Nation Address. Dahil naniniwala tayo na yung SONA ay hindi sinasabi, binabanggit lang hindi yan speech lang ng gobyerno ni Duterte. Ito ay yung malawak na pagkakaisa-isa ng mga mamamayan na sinasabi natin, yung mga kampanya natin, simula pa sa pinakamahihirap hanggang sa middle sectors gaya ng health sector. At yun nga, ang SONA ay gaganapin sa merong 2 programa. Ang isa ay ang health program, 8 o'clock siya sa may Philippine Heart Center At ang multi-sectoral SONA naman ay gaganapin sa Commission on Human Rights sa QC rin 10 o'clock ng umaga rin sa Lunes. At yun, nananawagan tayo na lahat na sana ay makapagsuot tayo ng white uniform para mapakita natin na yung mga taong nakaputi ay hindi lamang makikita sa school, hindi lang makikita sa loob ng ospital, makikita rin natin yan sa kalye at pinaglalaban yung mga karapatan hindi lang ng sectors natin, kundi yung nakikiisa tayo sa iba-ibang sectors ng society. At gusto rin natin mapakita na tayo ay merong isang goal with them na magkaroon ng isang maayos na lipunan para sa mga Pilipino. Ayun. Kaya ang sigaw natin ay House Duterte, SONAG kaisa, health is a right, health is political. Ayan. Maraming salamat po ulit.
Thank you, Kuya Jed, for those closing words and for that inspiring call to action for us. We are med students, but most of all, we are citizens of the Philippines, and we are Filipinos. Thank you, everyone. And again, this has been Res IPSA LOQUITUR, the Philippine government response to the COVID-19 pandemic. This webinar is presented and organized by the Philippine Medical Students Association together with its official partners, Ateneo School of Medicine and Public Health Student Council, Bicol University College of Medicine Student Council, De La Salle Medical and Health Sciences Institute of College of Medicine Student Council, Pamantasan ng Lungsod ng Maynila College of Medicine Student Council, St. Luke's Medical Center College of Medicine Student Council, University of Perpetual Health System Jonelta Foundation School of Medicine Student Council, UPM University of the Philippines Manila College of Public Health Student Council, University of the Philippines Dentistry Student Council, University of the Philippines Pharmaceutical Association Student Council, Pamantasan ng Lungsod ng Maynila Supreme Student Council, and of course, special thanks to the Filipino Nurses United for sponsoring this webinar's Zoom account. Once again, this has been your host, Bobby Camila Tendido from the National Committee of the Philippine Medical Students Association. Thank you for joining us today in Zoom and in YouTube, and I hope we all have a great day. Again, so this is the end of our program, but just some reminders. We also have a health sector Twitter rally at 9 p.m. later. So let's make our voices heard and let's make hashtag health is political, hashtag Sona di na maulit, and hashtag Sonag kaisa trend. Let's raise productive and insightful discussion and promote our advocacy through using our official hashtags again to discuss this webinar and of course to make our voices be heard later at the health sector Twitter rally. Our official hashtags once again are hashtag Sona di na maulit, hashtag health is a right, hashtag Sonag kaisa, and hashtag Sona 2020. And educating ourselves doesn't stop there, guys. So to learn more about the campaign of the health sector in this year's State of the Nation address, we can also access PMSA's primer at PMSA's Facebook, fb.com/PMSA National, and Twitter at PMSA National. That is all. And I hope, again, we have a great day and that we continue to keep on the spirit that brought us here to listen today here. Thank you, everyone.
Thank you.
And once again, this has been the Philippine Medical Students Association.